where we take the suspension sometime later in the evening. The start time is 10 o'clock tomorrow and Wednesday, and the standard orders specify the outer limits of time within which we can start after the resumption period. So 10 tomorrow means an international 10, not a Beijing 10. Otherwise, they simply will not be able to continue. So this is going to be one continuous sitting. So that standing order remains suspended for the remainder of the sitting till it ends on Wednesday.
Introduction of bills.
Senator Cummins.
Mr. President, I beg to move the first reading of the Appropriation Bill 2026.
The question is that the Appropriations Bill 2026 be read a first time. Will those honourable senators in favour please say aye? Aye. Those against please say no. The things the ayes have it, the bill is accordingly read a first time.
Public business.
Public business is now the order of the day.
Order number one, sir. In the name of the Honourable Leader of the Senate, to move the second reading of the Appropriation Bill 2026.
Senator the Honourable Lisa Cummins.
Thank you very much, Mr. President. At the outset, I'm going to apologize for what is going to be the inevitable loss of my voice at some point during the course of the next few minutes, but I will do my best to get through the presentation of this appropriations bill. Mr. President, I too want to join you in expressing our condolences to the members of the dining room. All of us have, over the last several years, engaged with Andy. Some of us called him dads, and we're used to sitting at the bar or engaging with him as we pass through on our way to the lunch table. And I know that for him, his daughter Gloria, and his family, this has been a difficult time, and we want to also join you in extending our condolences to his family. We spent a lot of time in this place, and as a consequence, we built relationships with the people who work here, who are very much like family to many of us. And so we join his family in expressing condolences to all those who have been touched by his passing. Before I also get into the actual presentation of the appropriations bill, I also want to do something that I did not do on the last occasion we met when we did the constitutional amendment, and it was to acknowledge the contribution of those independent senators who served over the last term of Parliament. We have back with us our own Rev. John Rogers, Senator the Honourable John Rogers, and we're happy to have him. And of course, Senator Malalu will return, but there are others who served with us over the last term that. But I was on count to him. And the president has reminded me that Senator Connell was not long, but he was the last term, and I was going to come to him because he joined us late in the last term and he's returned, and we acknowledge his return. But certainly persons like Senator Christopher Maynard, Senator Lindell Nurse, we want to acknowledge their contribution and the relationship that they built. I get the honor of obviously continuing to work now with Senator Christopher Maynard in a different environment, but I am happy to have had the opportunity to have met and served with them here in this Honourable, the Senate, and I want to thank them on behalf of the government side, and I would risk to bet on behalf of the Senate overall for their contribution to the Senate over the last parliamentary term. Thank you very much to all of you. Now, Mr. President, this appropriations bill was presented in the other place a few weeks ago, and we had, subsequent to the presentation of the appropriations bill, we had a number of ministries presenting in the well of Parliament. And by that, for those persons who were not following or were not familiar, the well where we had specific ministries of government presenting on their estimates of expenditure, how it fit into government's overall program, what had been done, what was in train, and what was underway. Because, Mr. President, government and governance is, in fact, about coherence. It is about coherence in policy making and speaking to the relationship between the appropriations bills as presented by the individual ministries, the allocations that have been assigned for the upcoming year, the forward year, the second year, and then the third year even, Mr. President, but also looking back at what had been spent in the year before. That is the nature of the continuum of government. And so we see how government's expenditure has taken place, if you want to call it, Mr. President, like you have a hire purchase account, or you have a mortgage, or you have a car payment, and you amortize it over multiple years. The government has a given objective. That objective is the ultimate long-term plan, and we have amortized the financing of that long-term plan over multiple years. That's what the appropriations bill represents. And so in each year, each financial year, we look at these big books that I see around the table and at the back of the room, that ministry by ministry by ministry will assign the estimates that have been allocated to that ministry. It will have heads of expenditure, specific budget lines assigned, and it will tell you what is meant to be done. What is not there, Mr. President, would be the specific activities which are being undertaken under those heads. Those things historically would come in the government's program budget, and you'll see them in the program budget that will break down the specifics every year. Now, in more recent years, over the last few years, we have the commitment for results framework, which is outcomes oriented. So it takes the original appropriations bill, the original government program budget, and it assigns results. Those results would include the missions framework. So there is coherence. It's not in a single place. It is laid out over multiple documents, over multiple years, but there's absolutely the coherence of government policy. The budgetary statement, however, which then comes at the end, then has a very specific role to play in terms of what is being proposed there. But if you take one thing on its own, without policy coherence across multiple documents, then you're always going to be missing the mark. And so, Mr. President, I want today in my presentation to treat to the appropriations bill by looking at those things. Now, these estimates in the appropriations bill cover the financial year 2026 to 2027. That financial year will begin on April 1. Equally, Mr. President, over the course of the financial year, and I'm taking time deliberately to go over this because I know that we have a number of new senators here in the Honourable Chamber, and we also have a number of people who don't necessarily, if you don't work in government, if you don't anchor in government, if you never anchored your work in government, it sounds like some foreign language. So I'm deliberately taking the time because we hear a lot of commentary from time to time about what is not there, what was not spoken about, what is missing. And I'm simply taking the time to make sure that people understand where these various things come from. Now, we equally have during the course of the financial year, the estimates of expenditure, yes. Now, Prime Minister, certainly in the how many of years that I have been in cabinet, Prime Minister's posture has always been not to come for supplementary resources during the first 6 months of the financial year. And that really is because it is an indication from her that if you need to have supplementary resources during the course of the financial year, you haven't planned. You haven't planned properly. And by planning, I've already talked about the program budget for the government. I've already talked about the missions framework. I've already talked about the commitment for results framework. But what I haven't yet talked about is the fact that every ministry is required now, by law, under the Procurement Act, to have a procurement plan. And so the procurement plan correlates to all of those things, and it tells you what you are meant to be procuring during the course of the financial year. So there are multiple documents that all go together for government's planning. By 6 months in, you've been able to figure out what the government is executing on, certainly in my own ministries, and I know that for some of the others, on a quarterly basis. We're going to sit with our ministry. We're going to sit with our officials, we're going to sit with our financial controllers, and we're going to say, here's the program budget, here's the missions framework, these are the things that are programmed for the course of the financial year, what have we spent? And we can tell you within quarter one that we are executing on 10, 15, 20, 30% of your expenditure expectations. We can tell you that by Q2, you're halfway through. We can tell you that by Q3, you're falling behind, you've only hit 55%, and you're gonna have to expedite your rollout and your execution of your projects. And then somewhere by the time Q3 rolls through to the end, and you start Q4, some of us say to our officials, that money, if it's not spent, is going to get, in Barbadian parlance, huffed. Prime Minister is going to huff that money. The Ministry of Finance is going to huff that money. And what are they going to do with those monies? They're going to see this ministry does not have the ability to execute on its full expenditure plan in the course of the financial year. Those monies then have to be reallocated elsewhere in the system in areas that do need money, where there is a shortfall, where they're executing faster than another ministry, and there's the ability for a greater rollout. And especially where you have big ministries with big public service expectations like education, where there's always a need for CapEx work there, where there's always a need for refurbishments of schools, like the Ministry of Health, where you have to deliver health care for people. There's always going to be the reallocation, like the Ministry of Transport and Works and like those social sector ministries. Those are typically the areas where government will reallocate financial resources from areas that are not spending fast enough before the end of the financial year. And so come next week, you are going to see the other place meet, and they will have supplementary resources, and that will be their assessment from the Fiscal Risk Unit of the exceptionally skilled professionals in the Ministry of Finance who are going to say, here is what is currently in the allocations for these ministries. These are the monies that are unspent. In addition to that, Mr. President, you will have another source of revenue. You will have a revenue call that will come in from VAT take, and it will come in from the corporation tax take. And so those are revenues that are coming in addition to unspent monies. And so that's where you're going to see reallocation of funds. So those are some of the things, not even all of the things, but some of the main things that I wanted to put into context. So anybody who says that there is not coherence because of one part of it does not understand governance and government and how it works and how government financing, government programming works. So those are some of the elements. And I'll come to some of the sources of government financing in a minute. Over the last year or so, last few weeks, as we talked about the estimates has around $459 million of planned expenditure coming from foreign sources. What are these foreign sources of financing? The Inter-American Development Bank, I'll talk a little bit more about what that is during the course of today. The World Bank, same thing there. The European Investment Bank, we'll talk about that. The Development Bank of Latin America and the Caribbean, CAF, we've heard quite a bit about that. And then there's the Exim Bank of China. Totally, overall, we have approximately $459 million in foreign financing and approximately $228 million in domestic financing. So you start to accumulate that and you get a sense of the source of financing. This is just financing. This has nothing to do with the additional take from government revenues, whether it be VAT, corporation tax, and so on. I'm deliberately taking the time to go through this. In total, the debt service relating to those foreign and domestic sources of financing, you have approximately $1.5 billion covering both interest payments and the amortization rates. But all of those things having been said, let me go back to some of the discussions that we have had over the last couple of years. Mr. President, when I first joined this Senate, I joined the Senate as the chairman then of the Bridgetown Port. At the time, that was what, 2018, September 2018? Within 2 years, we had COVID. The world changed then. By change, I meant that shipping lines became disruptive, supply chains became disrupted, access to goods became disrupted, access to services in some cases became disrupted, and the world became a very different place. Now, Mr. President, fast forward to 2026. And if you thought the world was a very different place in 2018, my God have mercy, 2026, it is an entirely different place. And so at each phase, you have seen government's appropriations bills and government's expenditure correlate to where Barbados is in the world at a given time. We saw in 2018 a government responding to a fiscal crisis and attempting to do a debt restructuring and to manage the fiscal crisis of the country at 2018. By 2020, we saw the government dealing with COVID as a crisis. And you saw the government then by 2021 dealing with COVID as a crisis in 2022, then dealing with unplanned expenditure related to our resilience agenda and the climate crisis, and you saw the natural disaster issues. So government had to respond to those things and the attendant social policy requirements that came about as a consequence. So government's expenditure changed. And it changed as you saw revenue evolved. If you remember, Mr. President, when we had COVID and the bottom dropped out of one of our sectors, you saw a decline in revenue in the millions of dollars in a relatively short space of time, and that gap had to be filled from somewhere. So government's financial planning changed then. So here we are now in 2026 with the world in crisis, war, rumors of war, and the news this morning in the New York Times talked about the bombardment of Tehran, and I'm sure that the Minister of Foreign Affairs is following these things even more closely than many for obvious reasons. But what do these things in abstract places, remote places, far away from here have to do with us? Everything, Mr. President, everything. They have everything to do with us. We import oil. We import pretty much everything that we consume. We are a price taker, not a price setter. In economics terms, that's what they will tell you. We are not determining the prices of anything. And what that has meant as a price-taking economy like Barbados, that cost of living has then become a key issue for Barbados. And so, Mr. President, I want, first of all, to look at the allocation of expenditure for different ministries, but I want to start by focusing attention. And over the course of the next 2 days, 3 days, we'll hear from different persons speaking on different subjects. So I am not going to get into all of the ministries, but I've given you the global overview. But I am going to take just 2 minutes to perhaps show how the cost of living issues driven by energy crises and the impact, therefore, on everything that has a throughput in the productive sectors has then evolved. Mr. President, in 2022, 2023, the ministry that I had the privilege of leading then was the Ministry of Energy and Business. The allocation and the estimates of expenditure at the time was $68 million. By 2023, 2024, the allocation and the estimates of expenditure was $74 million. 2024 to 2025, the allocation was $82 million. 2025 to 2026, the allocation was $86 million. This year, Mr. President, the allocation is $87 million. And so there has been an incremental increase in the allocation to energy. And that's driven largely by us subsidizing and taking putting greater absorption measures in place for all of the external challenges that we are facing. What that has meant, Mr. President, is that the government has been able to put a number of measures in place, and I'm actually not going to spend any real time on energy and business today for a reason which I will share in a minute. The Ministry of Energy and Business has been spoken about extensively in the other place and in the public spaces by the minister who has now taken over that portfolio. And I'm happy that he has, as people would call it, a foundation to run on, a platform to jump on, and that the ministry is in a good place, a good state that has allowed him to run forward without any hesitation. And so here we are now with a different ministry that I want to spend most of my time on, Mr. President, and I want to take a moment, having gone through the overall estimates of expenditure, where the source of funds comes from, and why this is important at this point, Mr. President. I want to make, however, 3 points. The government's financing has responded to both the external and the domestic circumstances facing the government. External circumstances by way, Mr. President, of engagements with partners like the Inter-American Development Bank, but also like new relationships with CAF, with the Saudi Development Fund, Mr. President. Those are all newer relationships driven by the exigencies of international circumstances, but domestic circumstances as well. What do people want? What are people looking for? What are people calling for? And those are some of the things that you have seen, Mr. President. We talked about Barbados in historical terms, punching above its weight. We can see Barbados punching above its weight in so many ways. Prime Minister has become the global voice of climate. She has become the global voice of the Bridgetown Initiative. We have the entire international financial architecture being fashioned after something called the Bridgetown Initiative. If that's not punching above our weight, I am not sure what is, Mr. President. We had the Prime Minister over 6 years serving as the chair of antimicrobial resistance. I'll talk about that in a little bit, under the World Health Organization. Even in the World Health Organization, we've seen some changes over the last little while, countries withdrawing from the international architecture and the rules-based system to which we're all accustomed. Barbados is functioning, Mr. President, in a space that is unprecedented. It does not allow this government, who anchored through 2018, who anchored through 2020, who anchored through 2022, now in 2026, to play only to partisan considerations or things that are parochial but are not comprehensive. This is a government that has steered us through the most difficult of times. And so, Mr. President, the intention is that while Barbados may be small, while in geography we may be a small state, we are proving that small countries like ours can lead big conversations on the global stage. That has been this government's legacy so far, Mr. President. So now, I want to get into the specifics of the ministry that I now have the privilege of leading, because I want to get right into that on purpose. Over the course of the time of the discussion, there are other things that will come up, I'm sure, and I will speak to them as they come up. But this is my first engagement on matters as Minister of Health, and I wanted to use my time having painted the broad macroeconomic framework to speak about this, Mr. President. Now, Ministry of Health and Wellness, the allocation for this year is $485.7 million. $485.7 million. Mr. President, in 2022, the allocation for the Ministry of Health was $410 million. 2023, allocation for the Ministry of Health was $430 million. In 2024 to 2025, the allocation was $455 million. In 2025 to 2026, it was $470 million. And this year it is up to $485.7 million, Mr. President. That has nothing to do with any move-ins that you have seen. And when I call move-ins, I talked about the supplementary allocation of governments over the course of the year. You did hear in the other place last week the additional allocation to the Ministry of Health coming from the Minister of Finance. What the Prime Minister did not get a chance to tell everyone she has done, and to make me struggle a little bit more to carry the weight of the existing Ministry of Health, is that she has also transferred sanitation back into the Ministry of Health, and so the Ministry of Health and Wellness is also carrying the sanitation portfolio. And so as a consequence, we are carrying the Sanitation Services Authority. You will hear more about that during the course of this week, probably on Wednesday. You have the Sanitation Services Authority, the landfills, of course, waste disposal, and general garbage collection, waste and sewage. So that has now been transferred back under the Ministry of Health. And so together with my Minister of State, Minister Davison Ishmael from the other place, we will carry these two portfolios. So, Mr. President, we have clearly, demonstrably, by the numbers I have just given, increased our allocation to healthcare. I have not spoken about SSA as yet. That will come later. But under healthcare, that's what I've spoken about. And I want to go directly to the concerns that the public has raised on healthcare. Waiting times at the Queen Elizabeth Hospital, without a doubt, number one, public policy consideration. Waiting times at polyclinics, without a doubt, definitely an issue. Access to specialist care and access to surgical facilities. Those are the things that typically, from a scan of public sentiment, are causing people to groan like someone to my left just did. So, yes, I know, right? So, Mr. President, here's what I want to do over the next few minutes. I want to share what I have experienced and what I have found. Over the last few weeks, I've taken the time, as I said I would, to listen. And by listening, what have I been doing? I've had the opportunity to visit every single polyclinic in this country and to meet with every single member of staff present in those polyclinics. I've had the opportunity to visit the district hospitals and to meet with the staff there and even see the patients in those locations, Mr. President. I've been in the Queen Elizabeth Hospital. I've spent the time over the last week, every day, inside the Queen Elizabeth Hospital, not in my office. Not just meeting the doctors and the nurses, but meeting the orderlies, meeting the cooks, meeting the people who work in the laundry, meeting the people who work in the labs, meeting the pharmacists, meeting the people who are part of the cogs of the wheel that keep the system moving. Everybody goes together. And so, Mr. President, what I have found over the last 4 weeks of assessing this behemoth of a ministry that the public is pretty concerned about whether it works or it doesn't work, is that there are some things that really work really well. There are some things that work well. But you know, we as a Barbadian people, at the end of the day, health is one of those things where it's personal, right? It's personal. It's one of those things where I've told the staff as we've met, people don't meet you by choice. It's not like tourism, where people have chosen to come to the country and so they're arguing for what they paid for. It's not like energy, which oftentimes is an investment opportunity and people have chosen. It's not like business, which people are investing in and so on. But it's personal. You've typically met people on the worst day of their lives. You've met people when they're at their most vulnerable. You've met people when they're sick or their loved one is sick. And so what happens there is more deeply felt than anything else. It may be reasonable. Sometimes it's not unreasonable, but it's all expected and understandable because it's so personal to people, right? So here's what we have found so far. These estimates of expenditure include a ton of things that are meant to strengthen the healthcare system. What do we have in these estimates so far? Healthcare system strengthening. We have the investments coming by way of the expansion of the Queen Elizabeth Hospital over onto the new Enmore site. Over $387 million is earmarked for that in principle. That allows, Mr. President, and that's loan financing. That's meant to deal with procurement and equipment upgrades at the Queen Elizabeth Hospital. Then there is a separate body of financing, also accounted for in these estimates, that is designed to go towards polyclinic refurbishment. When last, the David Thompson Polyclinic in St. John, which I've seen, was the last and the newest of the polyclinics. That was 2016. It was finished and delivered in 2019. But before then, Mr. President, when last have we seen a new polyclinic? Every polyclinic in this country, Mr. President, 7 of them will be completely refurbished and upgraded, and 2 of them will be completely rebuilt. That is programmed in these estimates and is meant to take place in this financial year, to begin in this financial year. So what have we started to do, Mr. President? We started the process. Each polyclinic has outlined what it is they're proposing to do. They've outlined what they're expecting to have a full state-of-the-art 21st century forward-looking polyclinic to look like. But I'll come back to that in a minute because there is a deficiency, Mr. President. I'll come back to that in a minute. The Queen Elizabeth Hospital has done the same thing. The Queen Elizabeth Hospital is meant to expand across the way onto the Enmore site. And that Enmore site is meant to be connected by a bridge to the main facility, and then the main campus is also meant to have some refurbishments. That is also meant to begin during the course of this financial year, Mr. President. We've seen the new geriatric hospital on the outside. It looks ready to go. Someone asked me the other day if there are lights, because they don't travel at night. They said there are lights on a new geriatric hospital. I said it looks like you can land a plane. It looks so much like a runway when you pass there, but they are fitting out the inside of that new geriatric hospital, and we're going to see that opening during the course of this financial year as well. Now, again, the way the estimates runs, the financing for the new geriatric hospital began in financial year 2025 to 2026. You're going to see it closing off in financial year 2026 to 2027. Government is about coherence and it's about continuum. So that's what you're going to see, Mr. President. But you know what I found over the last couple of weeks as I've gotten into the weeds of my listening tour, as my staff has called it? We have allocated increasing amounts of finances in every financial year. We're now at 22% of total expenditure this financial year in primary health care, namely in the polyclinics. 22% of our allocations have gone. Last year it was 17%, and we're spending more money in our polyclinic system. But Mr. President, here's what we're finding in Barbados at the same time, and I know that Dr. Connell would be in a position to say this perhaps longer and more often than me. What we are seeing, Mr. President, is that the wait times at the Queen Elizabeth Hospital and the issues at the Queen Elizabeth Hospital in A&E is directly correlated to the systems between the polyclinics and the Queen Elizabeth Hospital. People are presenting sicker because people are going to the doctors later. They're not going to get their primary health care. They're not going to get their checks. They're not managing their non-communicable diseases as they should. And then by the time they show up at the Queen Elizabeth Hospital, they're sicker. And so they spend longer times internal to the QEH hospital in tertiary care, which means that discharge times are extended. And what that means is that the throughput then from A&E is compromised. It also means, Mr. President, that 24%, this is the other part of what we have found, 24%, and the health sector report of 2023 also shows quite a bit of this, and you'll see it correlated throughout the estimates over the last 2-3 years. 24% of the cases that do present at the A&E should not be there. 24% of the persons who present in A&E do not need, they're neither an accident, neither are there an emergency. And so what ends up happening a lot of times is that in the absence of going to another facility, either a polyclinic if it's a 24-hour facility, or a private individual doctor, or waiting until the morning and going to the hospital, people go to the QEH, 24% of them. And they spend extremely long wait times because persons who are genuine emergencies or genuine accidents are always going to be triaged and handled first, and it results in longer waiting times. So how do we manage that? How do we make sure that people feel that the standard of care is such that they do not need to all descend on the Queen Elizabeth Hospital? Not to mention, when things happen like a mass casualty or a shooting or something like that, and people then have to find their way into the A&E, either by ambulance or by private vehicle, and the A&E has to be shut down, and you divert resources away from dealing with other persons to deal with those instances. So, Mr. President, we have some real challenges that we have to navigate on terms of system. So a modern health system is what we're working through now, but that system doesn't begin with a hospital alone. It doesn't begin with new polyclinics alone. It begins with a complete re-engineering, business process re-engineering of the patient flow of a hospital. And therefore, Mr. President, the ministry's remit in this financial year is to effect health system transformation, not health sector, health system transformation, looking at all of the constituent parts of the health system. And by the health system, I'm talking about what is in your community, what is in your polyclinic, What services can you get in your polyclinic, and when can you get them, and for what purposes? How do we keep people well in their homes and in their communities and using the polyclinic system without getting to tertiary care? How do we improve on our secondary healthcare system so that fewer people find their way into the tertiary healthcare system? But here's what is also true. How do we make sure that when persons leave the Queen Elizabeth Hospital, post-acute care, that they also have the ability to have step-down care, rehabilitative care, post-acute care, so that sometimes, Mr. President, we have two things happening. Last week, we had to make an appeal to the public. Come and get your relatives. Come and get your relatives. There are people who have decided that they don't want their relatives and they're leaving them in the Queen Elizabeth Hospital. That happens every single day. There are those, we have around 40 persons in the Queen Elizabeth Hospital who have largely been abandoned. And their relatives, when the social workers tell me, they call their relatives, I ain't coming for he, I ain't coming for she. I actually personally feel, Mr. President, that when persons take those positions, that the state has to step in and make a decision, okay, if I am looking after this person, then you shouldn't be cashing the pension check, no? Right? There has to be some kind of responsibility there. So there are those extreme cases, but there are other genuine cases at the same time. And by genuine cases, what do I mean? I mean, Mr. President, there are persons who, in the absence of hospice care, rehabilitative care, or post-acute care, do not have anyone with the ability to care for them in their homes, and their relatives, out of love for them, not abandonment, know that they can't be cared for in their homes, and they're better off internal to the Queen Elizabeth Hospital. And so they stay there until such time as they're fully recovered and can go home. That is why, Mr. President, in these estimates this year, you see an allocation for, and you saw it also in the Barbados Labour Party manifesto, and we're delivering on that, for a rehabilitation facility and hospice care, which would allow for monies to be allocated to taking care of persons after they leave the hospital. So how do we strengthen persons going into the polyclinic system, in your communities, and then in the Queen Elizabeth system? So these are some of the things that we are navigating, Mr. President. So here is what, I missed something. Here is what we are proposing to do during the course of this financial year as we develop the plans, Mr. President. The 2023 health sector report tells us that we have 9 polyclinics and 2 outpatient clinics delivering primary care, while acute, secondary, tertiary, and emergency care, we know, are largely delivered through the QEH. But it recommends, Mr. President, and that is proposed in these estimates of expenditure, for extended hours to be resumed at the Maurice Bayer Polyclinic and the Randall Phillips Polyclinic. These are meant to come back in place, having been suspended in 2020. And we also know that the Sir Winston Scott Polyclinic is also meant to be a 24-hour facility. And what we've seen is that they're handling 49% of the cases that are then subsequently going over to the Queen Elizabeth Hospital. I already spoke earlier about the challenges that we're seeing with persons coming into the system. Mr. President, these estimates of expenditure also cover a number of other areas. We've seen, and I mentioned earlier, the country being positioned to be where it is. We also have seen an allocation being increased for non-communicable diseases, and for there to be expenditure relating to things like how to manage non-communicable diseases in your community, but also how to invest in things like the teaching of healthy lifestyles, a nutrition unit. All of those things are seeing increases in expenditure, Mr. President, in these estimates of expenditure. One of the things that I'm proposing to do during the course of this year, Mr. President, is to be able to build a transformation committee. A transformation committee that looks at the system as it is overall, not the sector, but the system. How do we design patient flow, Senator Connell? How do we have a system that allows for us to be able to identify who should and should not be where, who needs what and from whom, and at what level? How do we integrate with the public sector and with the private sector? How do we then work with the urgent care and the FMHs and the Sandy Crest of the world to be able to deliver services on an as-needed basis? How do we have additional capacity? Mr. President, we've also met with the Barbados Community College and with the nurses about the importance of investment by way of the Ministry of Technical and Vocational Education, MTEE, and they have in their estimates of expenditure, you will see them in this appropriations bill, Mr. President, the expansion of, and you've heard the minister for this ministry speaking about the creation of the University College of Barbados. And in that, you're meant to have a number of specific schools that are meant to be launched. In those schools, Mr. President, you then will have a school for nursing. And that is meant to increase the capacity for us to pull out more nursing, teach more nurses to go into the system. But there is more, Mr. President. These estimates of expenditure in accounting for there being a University College of Education, University College of Barbados under the Ministry of Education, MTTE, not Educational Transformation, accounts not just for nurses, but for pharmacies. And one of the things that we are going to be doing under these estimates of expenditure, Mr. President, is building out something that I did in the Ministry of Energy, the future of work in healthcare. What are the skills that we need to build over the next year, the next 2 years, the next 3 years, to be able to correlate to the shortages we're experiencing now on the one hand, but also to develop new disciplines and new specializations that position Barbados to be able to provide the kind of care that we have not been able to provide so far, Mr. President. So those are some of the things that we're meant to do as well. We are also, Mr. President, in these estimates allowing for the allocation of extended hours in the polyclinics that I mentioned and to divert non-urgent A&E demand. We also, Mr. President, are seeing in these estimates of expenditure, significant expenditure on the diagnostics component of the healthcare sector. What do I mean? This financial year, with the combination of our own budget and from philanthropy, we have seen a linear accelerator come into Barbados. Now, let me just address that very quickly. We never had a linear accelerator, Mr. President. We have one now for the first time. But I remember when we had a drive-through scanner in the Bridgetown port. The scanner was one thing that we had to install in 2018, 2019. But the civil works required to install that kind of equipment is not a regular wall. It's not a regular build, and so it takes time. And so a linear accelerator then needed to have the civil works executed also under the QEH to be able to facilitate that the width of the walls necessary. I remember, Mr. President, we had the Environmental Protection Department coming in. I remember us having the offers of assistance, and they subsequently provided the assistance from the International Atomic Energy Agency to come and to look and review and to make sure that the radioactive rays were negligible and were not likely to affect the people who were working in those areas. A linear accelerator in Barbados is meant to do the same thing. We never, for the record, had a CT scan in the emergency room of A&E, Mr. President. We have one now. I've seen it with my own 2 eyes. It is there now. You used to have to take a patient upstairs to another department, up to radiology to be, now you have a CT scan in the A&E department, Mr. President. Those are investments from the last financial year. This financial year, Mr. President, the expectation is that you will have diagnostics equipment, not just in the A&E, which was done this last year, but to have diagnostics equipment in 3 polyclinics potentially across the country, because that also helps to take some of the pressure off of the emergency room and to make these polyclinics fit for purpose. And equally, I have seen with my own 2 eyes in the current infrastructure how walls were constructed originally in at least 2, maybe 3 locations for X-ray equipment that wasn't there. But that is meant to be in the new facilities that will be there. Those are programmed in the estimates of expenditure, Mr. President. Now, drugs, medicines. That's a big deal. I hope that the chair of the Drug Formulary Committee, whenever he speaks to the public, that he speaks about the challenges that we have been having with drugs. In this estimates of expenditure, Mr. President, you will see some new areas that have not been there before. The Barbados Pharmaceutical Inc. Barbados Pharmaceutical Inc. is an entity, Mr. President, and I want to acknowledge Senator, the Most Honourable Jerome Walcott, for having piloted these initiatives through the Ministry of Health over the last several years. The partnerships with the governments of Rwanda and globally to allow for Barbados to have a pharmaceutical industry in the first instance, one, to be able to have a regulatory regime that did not exist for the first time, to be able to get us to tier 3, ultimately over the next few years, and they have been working on getting the new regulations, and I expect that in due course, I will have the honor of bringing that legislation here, Mr. President, for the Parliament, this place and the other places to debate. But we have, in these estimates, increased allocations for the Barbados Drug Service to be able to make sure we can account for the things like our stockouts, Mr. President, but also to find new suppliers. Those are some of the things that we are navigating. Now, I've heard from many of the advocacy groups about the importance of NCD outcomes. These estimates, and I know that many people were looking for statements to be made in the budgetary statement, for example. But I remember, as I said to one of them, because you don't hear it in the estimates, doesn't mean in the budget, doesn't mean it's not in the estimates, doesn't mean it's not in the program budget, doesn't mean it's not a continuing program that you have seen over the last number of years that there may be an allocation for. And so equally, there is money allocated in the estimates of expenditure for NCD's outcomes improvement and to be able to have investment in the areas that are concerned. And so, Mr. President, you have under the UNOPS agreement that has been signed by the ministry in collaboration with the Queen Elizabeth Hospital, a budget of approximately $16.5 million US dollars allocated from a European Investment Bank, I spoke about them earlier, loan, and that is scheduled to be completed by November of this year. That is going to deliver, Mr. President, a health information system. And that is meant to make sure that there's a correlation between when you take your patient notes from one part of the QEH to the next. What you will see in this financial year, Mr. President, is the expansion of that 2025-2026 programming into 2026-2027 program that creates interoperability between the Queen Elizabeth Hospital and the polyclinic system of Barbados. So you're going to say, if I have gone to the polyclinics, Mr. President, and I have seen my doctor, and I've had blood work, the information belongs to me, yes. But I want equally to be able to take that information if I have to be admitted to the Queen Elizabeth Hospital. I don't want to be walking about with notes in my hand anymore in 2026. That's an anachronistic process. And so now we're moving away from that to make sure that the patient not only owns their information, but can take their information to whichever doctor is seeing them, whether in the public system or even in the private system, whether it is your scans, whether it is your diagnostic information, whether it is your record of medications that you have been taking, all of that will now be captured in the health information system, and your appointments are also meant to be captured in the health information system. So these are some of the areas, Mr. President, that you are seeing in these estimates of expenditure. So I want now to move on to the broader financial implications. And I'm deliberately managing, because I know I'm going to lose my voice, so I'm deliberately managing what I say at this point, because here we go. Now, starting to manage my voice. Now, Mr. President, here is the sanitation allocation. We also have under the Ministry of Health and Wellness, the sanitation allocation, and we have the, as I mentioned here, the waste management, vector control, environmental sanitation, and disease prevention. If we don't have our sanitation managed at the community level and at the household level, what ends up happening, Mr. President, is that you have health outcomes in the health sector. And so there is a significant investment that you're going to see in the sanitation services sector, and I'm looking forward to hearing that full presentation when it comes during the course of the Senate. The chairman of the Sanitation Services Authority sits in this chamber, and they will deliver a far more comprehensive presentation on the Sanitation Services Authority. But suffice to say, Mr. President, that there is an allocation in the estimates for the Sanitation Services Authority for waste management overall. And interestingly, over the course of this financial year, there is meant to be a partnership with the Sanitation Services Authority and the mangrove landfill at Vaucluse to be able to transition that facility into a green energy park that allows for us to use energy to convert the waste that has a higher calorific value, to be able to create energy, and in so doing, it reduces the cost of the management of that particular facility, but it also allows for the government to manage the annual transfer to the SBRC for the management of certain types of waste that is accounted for in these estimates of expenditure, Mr. President. Now, these estimates, as I have outlined, Mr. President, they account for the global uncertainty that I've talked about. And I want to take just a moment to speak about global uncertainty and how we have programmed in these estimates. In previous estimates, you would have seen the Inter-American Development Bank. You would have seen the World Bank. They are still there. Over the course of last week, for an entire week, we brought, for the first time in history, and it was interesting to sit in a room and hear them talking about it, 4 development partners working together on one single intervention. For a week, last week, we had the World Bank, the Inter-American Development Bank, CAF, and the Caribbean Development Bank together working on a debt for health swap. A debt for health swap. Now, those of us who have been in the chamber and those who have been watching the news over the last several years, you have seen the government talking about a debt for climate swap. And we've done that before. We've bought down more expensive debt, replaced it with less expensive debt, and used the savings to reinvest in the sector. That's what is happening in this financial year. And so in this financial year, and we hope to be in a position to deliver it by the end of October 2026, which would fall during the course of this financial year, for a total of an additional $500 million in health sector expenditure, Mr. President. That is meant, in addition to what you've seen programmed here, but it's still being developed to then fall into financial year 2026, 2027, financial year 2026 to 2027, 2028, and then financial year 2028, 2029, and onwards. What are those monies meant to do? $500 million, $150 million approximately from each of the 4 development partners. What are those funds meant to do, Mr. President? Those funds are meant to go back into financing very specific things. When the Prime Minister started framing this out along with my predecessor, Senator Walker, Prime Minister gave them a couple of charges. You need to work with us to identify how we make changes. How does Barbados eat? What is our culture of doing a number of things? 4 main things, keeping it very simple so that the monies are not being allocated to buildings and structures and infrastructure. Not at all. It is meant to tie health to our culture, how we live, how we operate on a day-to-day basis, and how do we make interventions in those areas. And so that will be an additional allocation into the Ministry of Health that you will see and will anticipate to be programmed during the upcoming financial year into the next financial year. So coherence, connection, comprehensive, and very much, Mr. President, accounting for the uncertainty of the global climate that we are operating in. Equally, Mr. President, I believe the last day that we met, you heard me, I think I may have made mention subsequently in the media, I slipped out to the chamber and went and signed an agreement with the governments of India, an India pharmacopoeia agreement. That also was work that was started by my predecessor. The beauty of government being a continuum is that in 4 weeks, very little of what I have done is about me. A lot of it is about work that has already been started and has been in train, and so government is continuing. And so, Mr. President, the pharmacopoeia agreement is one that has been signed, was negotiated over several months by my predecessor. And so it is about making sure that there is a collaboration between the government of Barbados and the government of India. Again, New partners, where did the government of India's collaboration come from? Many of us remember during the course of COVID, who was the first country that came and gave COVID vaccines to Barbados? It was India, Mr. President. You remember President Modi, because of his collaboration with Barbados, was able to get a special award, and the Prime Minister recognized him in one of our independence anniversary award ceremonies. And so India has now been collaborating with Barbados to be able to deliver pharmacy solutions, but using a regulatory management system that is globally recognized. And when I say globally recognized, I'm usually talking about the World Health Organization. So that is something that is there now that is meant to help us with our management of the drug service and having access to drugs from a range of partners and being able to have drugs at a price that Barbadians can manage, but at standards that are acceptable to us. And the regulations I spoke about earlier. So we have 4 development partners in a debt for health swap. You have the Indian government working with us. But equally, Mr. President, we have new countries that are working with us on providing professionals to come and work in Barbados. We've seen the Ghanaian professionals who have come here. Now, today, we're working with Ethiopia. We're working with Ghana still. We're working with India still. And so, Mr. President, Barbados, even in our allocation of finances to program activities, is working with new partners to be able to deliver new solutions on behalf of Barbadians. So these are some of the elements that we have been navigating, Mr. President, that I wanted to raise today. And so as I wrap up this first part of my presentation, I want to come to the second part of my presentation, and I don't intend to use my full allocation today, otherwise I won't be able to talk at all for the rest of the time. But here's where I want to come now, Mr. President. Cost of living, cost of living, cost of living. It has been a continuous bugbear for Barbadians. It is what Barbadians have talked about most over the last little while. I think we've made it clear, the public has made it clear, even the economists have made it clear, we are a price-taking economy. We are not setting prices. We can't control shipping prices when they go up by 400% or 500%. We can't control those things. But we have made a number of provisions in these estimates of expenditure to allow for that. In the Ministry of Energy and Business, what are some of the provisions that we have made to account for that? One of the provisions that we have made to account for that has been the allocation to the Barbados Trust Fund Limited. Taking the allocation assigned to persons and their eligibility from $10,000, $5,000 in the first instance, $10,000 in the second instance, and taking that up to $20,000. At the time we started to make that transition, Mr. President, we knew that it would have required an increased investment from the ministry, from the government, in order to make that happen. An additional $10 million approximately, Mr. President, was anticipated. That is accounted for in these estimates of expenditure. But there's another component to that, Mr. President. The anticipation at the time, and I know that the new minister is expected to continue having these conversations, is that we would work with our development partners in the same way we're working with them in health and in other areas, work with our development partners to make available an additional sum by way of a grant that would allow for proof of concept investment, so that you have an additional sum of money for the small businesses, micro businesses in the country, to be able to have the benefit of that grant component to go along with their loan capital to allow them to build their businesses so that people can live. You've seen and you've heard the government talking about Acidilia is one of the things that we have been very proud of, and accounted for in these estimates of expenditure for Acidilia has been the expansion of Acidilia. And in what way are we proposing the further expansion of Acidilia, Mr. President? What are the things that we are proposing to do? In addition to what we currently have, Mr. President, is meant to be the expansion of the platform and having it integrated into the Asakuda World platform, so that you're able to see the landed prices and then able to see where the transfer pricing occurs along the supply chain, so that we're able to manage costs to Barbadians. So these are some of the elements that you've seen here. You've seen an increased investment in the Smart Energy Fund. The Smart Energy Fund has also been earmarked to create that greater level of investment currently, Mr. President, for the renewable energy transition from 2026, and those monies are meant to expire. We've expanded that program to allow for us to facilitate the transition to 2035 as opposed to 2030. So you will see that amortization of the financing over time. So the projected estimates revenue is projected at $5.8 billion in total. Total expenditure is set for about $5.8 million in this financial year. And the fiscal deficit is expected to be approximately $687 million, or approximately 4% of GDP. These are the things that this allocation is looking at. So I've talked about healthcare, I've made some recommendations, I've talked about what is proposed with the correlations between one ministry and another, in my case, Ministry of Health, and in the Ministry of Education, Technical Vocational Education, and even in the social sector ministries. So these things all combined, along with tourism, along with MIST, you will hear from MIST directly during the course of today, along with culture and youth, all of the ministries you will hear from, but cumulatively, these estimates are accounting for approximately $5.8 billion in expenditure, $5.88 billion in expenditure for this year. The nominal GDP is estimated at approximately $17.6 billion, and the government's operating balance is close to equilibrium. What does that mean, Mr. President? It means that although there has been this discussion around debt, the government has continued to lower its debt to GDP ratio consistently, despite all the things that I've spoken about from 2018 till now. And so the commitment to fiscal discipline and the reason why there is this equilibrium that I have just outlined is a demonstration of this government's fiscal discipline while investing in all of the things that I have outlined that are specific to what Barbados needs and what the global society, uncertainty requires of us. So the public debt is expected now, of the total amount that I just listed, 459 of that is meant to be financed through foreign financing, and 228 million of that is meant to be financed through domestic financing. So that is what we are expecting. So, Mr. President, look, the equilibrium that I have defined, I have described, the debt to GDP ratio that I have described is important to this government. We are at 100% now, and that was a target that we had set. 100%. We were not supposed to exceed the 100% ratio. In fact, we needed to bring it down. And we will see that happening, we expect, over the course of the upcoming financial year, because fiscal discipline matters to this government, Mr. President. We know what happened to us in 2018 and what we had to get under control as a result of the challenges that we experienced in 2018. And as a consequence, Mr. President, there will never be a circumstance where we will not attempt to, one, bring down the debt to GDP ratio, and of course, insist on and maintain fiscal deficit. So I mentioned before, the debt service ratio for those amounts, both foreign and domestic, is meant to be approximately $1.5 billion, and this debt, the debt swaps that we have been investing in have further given us fiscal policy space. So our debt to GDP ratio has been consistently declining, and it now stands at 100% of GDP, which is what government had anticipated we would have, and the government is committed to reducing that ratio down to 60% over the medium term. It won't happen immediately, it won't happen in one financial year, and it can't happen when the things that we want are the things that we want. You have to be able to balance it. You want to have a new house, you want to have a new car, you want new shoes, you want a new bed, new living room suite. You want it all, so it has to be paid for, Mr. President, but it has to be paid for responsibly. And so Barbadians want us to invest in healthcare. Barbadians want us to invest in education. Barbados wants us to protect the most vulnerable with social services. You've seen those allocations in the Ministry of People Empowerment and Elder Affairs. You'll hear more about that during the course of the next 2 days. You want us to invest more in healthcare. I've shared much of what is happening in this healthcare sector. You want us to be able to invest in education transformation, Mr. President. And notwithstanding that we are in the middle of BSAT season and I will wear my Cougars gear next week, we want us to invest. Y'all knew I was coming. We want us to invest in education sector transformation and to make sure that all schools, and in fairness, I see the guys around the table looking at me sideways, but I think we have all been excited by how the schools are performing and seeing all of the schools just tearing up the track and the field. All schools, never mind St. Michael's is going to do what St. Michael's does, but all schools. So, Mr. President, we are all still vested in education sector transformation. We must be, because the Ministry of Education is the second largest, the only other ministry that has as large a budget as around $400 million in expenditure, and that is earmarked for education sector transformation. That is earmarked for schools refurbishment. That is earmarked for children being in a position where they can go to school and feel as though they are in a genuine learning environment because the schools are retrofitted. That is because, Mr. President, you are in a position where children can feel as though at 11 years old they're not being discarded, and they have the ability to have the benefit of a serious investment in the education sector. That's being seen in these estimates. So in order to be able to deliver on the expectations and the legitimate expectations of Barbadians, you had to finance it. You had to finance it from revenue that we generate from the taxes, which have been lowered over multiple years, and this year was no different. You have to be able to generate it from revenue coming from external sources like corporation tax and from exports by growth of the economy. That's where you will hear from the industrialization agenda. You will hear from that during the course of the year. And so my overview has been deliberately so, a macro level overview, because different people will speak on different specific things, including the industrialization agenda, including the expansion of the work that's been happening with life sciences and so on. You'll hear about all of those things during the course of this week, Mr. President. Those things will help to generate revenue. Those things will help to fuel growth. Those things will help to create jobs. Those things will help to create opportunities for Barbadians, not just here, but abroad, Mr. President. Those things will help Barbados to continue to punch above its weight. The investment in the Life Sciences Center, those are the things that you're going to see. The GIGA initiative, you'll hear more about those things. Those are part of the development agenda, the productive sectors and the growth. Then you have the financing component, the ability for Barbados to maintain a rating, a sovereign debt rating that makes us attractive, not just to multilateral development partners with concessional financing, but to the market by way of bonds, which have been subscribed and oversubscribed because Barbados is punching above its weight, and the attractiveness of new partners to replace some of the instances where we have not had the ability to work with others in the same way that we once did. So that is where this government is going. Mr. President, this government is committed to development. This government is committed to transformation. This government is committed to reform. This government is committed to relationship management. This government is committed to relationship building. This government is committed to delivering change. This government is committed to delivering on economic opportunities for all. It's committed to delivering on accessible health care for all. It's committed to delivering on national resilience, Mr. President. This is a nation that is facing unprecedented challenges, and we are adapting, we are innovating, and in all instances and in all sectors in these appropriations bills, Mr. President, this appropriations bill, we can see that we are investing and we are expending. And so as we move forward, Mr. President, I commend this appropriations bill to this honourable senator, and I beg to move this bill be read a second time.
Thank you very much, Senator Cummins. Senator Walters.
Good morning, Mr. President. Good morning to my fellow senators. Mr. President, I wish to begin my presentation by prefacing it with the fact that in a lot of instances, when you hear the discussion around the appropriation bill, estimates of revenue and expenditure, and then followed by the budget, a lot of details are not really stretched out. A lot of the numbers are not really looked at in terms of what we're making or what we're spending year on year, expectation versus actual, etc. But the numbers are very important to this process because it really signals, as Senator Cummings said, where we get our revenue from, that we can do a lot of what we want to do that is set out for the coming year as it relates to expenditure. And working in business for all my life and at senior levels, sitting in boardrooms and having to convince investors to continue to put money into a business or to continue to have confidence in you. You have to defend the numbers and you have to show and justify how you have done, especially in the periods leading up to the previous periods leading up to the current period that you are looking to seek the support on. And in the case of government, I think it is something that we need to look at seriously as it relates to how does a government, after a period is coming to an end, and they're looking at a new budgetary period, a new financial year, how do they come back to the taxpayers who has financed the activities of the government to give you a snapshot of what they have accomplished, what they have not accomplished, what they have spent, and what they have not spent. And it doesn't have to be a situation where you are going down into the details of every ministry, but broadly, there have to be critical areas that you have spent on, overspent on, underspent on. There have been targets that you would have set out that you did not achieve, that you would want to share. There will be, and give reasons why. There will be targets that you exceeded significantly that you want to also share some of those successes as well. So it is not from a perspective of picking at a number or picking at a ministry, but it is from a perspective where if the government of the day says to the people of a country who finance the ability for them to spend the resources via tax revenue, via fees, levies, and via paying back loans by paying taxes and paying interest payments and principal payments towards those loans, all taxpayer funded. It is not unreasonable for us to look at a system where we start to really look at the performance of the current period that we're in before we even let down the barrel of the gun, so to speak, on what we are asking persons to commit to. And I start there because the most difficult thing that every government will have to do, in my opinion, is to control its spending. It's to ensure that it spends the resources that are put to its disposal to the best interests of those that the government intends to serve. That is the taxpayers, the residents of the country. And if that is important, then the reporting back to the persons, the residents, are important. In 2024, Mr. President, the government budgeted revenue of $3.5 billion, budgeted expenditure of $4.6 billion, with an estimated deficit of $1 billion. In 2024, actually spent $3.7 billion, actually received $3.7 billion, Mr. President, actually spent $5.2 billion, with an actual deficit of $1.45 billion. In 2025, the budgeted revenue of the government was $3.8 billion. Budgeted expenditure was $5 billion, with an anticipated deficit of 1.1 billion Barbados dollars. But the actual spend, based on the revenue of the estimates of revenue and expenditure, are suggesting that the government actually received $3.8 billion, but spent $5.7 billion, and the deficit for the year 2025 to 2026 will be around $1.8 billion. So just to put it in context, Mr. President, the government would have spent over $450 million more than budgeted in 2024, and another $700 million more than budgeted in 2025. Some may take it as a criticism, but it is a concern. And that is why I said that if the government is budgeting resources, and we go through a process where it is approved by Parliament, and you go through a process where you bring civil service into Parliament to defend some of that spending, it is only fair for you to come now and report to us on the actual spend, the highlights of those activities that will cause us now to see why you have overspent $1.1 billion over the last 2 financial years. And that is just going back in recent history. I suspect, Mr. President, that one would say that this is something that will be going on forever, but it's something that should not continue. We're living in different times. We are susceptible to everything possible that happens across the globe. And we need to be tight, and we need to be fiscally prudent. So, Mr. President, it is important for the government to, at the appropriate opportunity, and maybe during this time, and during, as the different senators state their feet to discuss the different ministries that they will report on, to give some highlights of, where we got to this overspending of $700 million in this current financial year, Mr. President. Because it speaks to confidence. It speaks to the fact that when a person takes up the document of revenue, estimates of revenue and expenditure, and sees that the government has overspent, and then hears in the news or listens to this debate and hears that the government now this year plans to make $4.9 billion in revenue and spend $5.6 billion of revenue. Where's the confidence in that, given the history of the performance of governments who traditionally has continued to overspend but not appropriately report that overspending to justify it to taxpayers? So confidence, this is a part of building confidence to persons that are out there, that are asked to go, to contribute their pay-as-you-earn, to contribute to VAT, to paying their national insurance contributions, to contribute to the health services levy, and the sewage and tax levy, etc. So I think it is very important. I wish also to draw to the chamber, Mr. President, that when you speak about financing the debt or financing the deficit, the shortfall, the government has also put out a plan to do that. And in 2024, the government expected that 59% of the deficit will be financed locally, domestically, and 41% would be financed by external sources. What actually happened, Mr. President, is that 58% was financed locally, and 42% was financed from foreign borrowing. In 2025, Mr. President, the government anticipated that 57% of the deficit, of the $1 billion deficit in 2025-26, would be financed from local services, local companies and businesses and local consumers buying bonds, etc. And that 42% would be financed externally outside of Barbados. But what actually happened, Mr. President, is that 17% of the financing of the deficit in this current period that is now coming to an end was financed locally. That is 40% below what was expected when they started their planning process. And 83% of the financing for this period is coming to an end on March 30th was financed by foreign sources. But why is this important? This is important, Mr. President, and I say this because you yourself would know from your professional life that there's a saying, paper never refuses ink. And that you can put anything you want on paper, regardless of if it is true, wise, or reasonable. That is the truth. So the question of trust comes into place. the question of what is before us, can we believe that it can happen? Can we believe that the government will only have a deficit of around 700 million? It is not to be precise, but in the ballpark of 700 million after overspending over $500,000, half of $1 billion consecutively over the last 2 years. How do you get trust from those taxpayers that are funding this program when you say to them that we are going to borrow 43% of the deficit from foreign sources, but you end up borrowing 83% from foreign sources? So, Mr. President, two things. We need to build trust. We need to build trust. And to build trust, we need to have a more meaningful dialogue around the estimates, around the revenue and the expenditure especially, Mr. President. How we are spending the money, how we're raising the money, and what does that mean to Barbados? Because it is convenient sometimes to speak about the debt to GDP, debt levels, foreign investment, etc. But it always comes back to the numbers, and the numbers have implications. And this discussion, although it will go in other directions, is largely about numbers. It's largely about financing a deficit of $687 million, Mr. President. But what is a signal to us is that regardless of how articulate the government is in terms of saying that we are going in the right direction and that the economy is doing well, the local economy, the domestic economy, there has not been a level of local investor confidence returning domestically. Because if you have a situation where you have planned to raise 57% of your deficit locally, and you are raising 40% below, you're only raising 17%. That means that the persons here, the businesses here, the persons that will go and buy bonds and securities, etc., the local investors are not interested in what we are offering, what the government has offered, and they're not taking that chance, that risk. Because we want to also forget the past. The past is that when the government came in and did the restructuring, that the local investors got the hit. The local investors who were also individuals got the hit. And that is still fresh wounds for them, although it is 7, 8 years on. So, Mr. President, local investor confidence has not been restored in the country. And the indication is there in the numbers. It is not an emotive statement, Mr. President. So how can we trust the government? How can we trust the government when they say that we will be budgeting a deficit of $687 million? When, Mr. President, we have a situation where we have supplementals that will come before this chamber in excess of $500 million as well, which means that these are funds that have not been budgeted in the current financial year, at the start of the current financial year that we're in. So, Mr. President, again, you say you're going to spend X, you get that approved, but you go ahead and commit expenditure, taxpayers' money, in excess of $500 million to then come and get that approved retroactively. Mr. President, these are the sort of conversations that we need to have because, as I said, this is a broader conversation about trust and the relationship between government and the electorate, and even it dives into voting. It dives into that confidence of a party being able to have persons say, I support this party. I support politics or politicians because you know what? They're transparent. They're honest. They can trust what they say. If something goes wrong, they come back and say, this is what went wrong, and this is why. And that's all I'm asking for, Mr. President, a process that really deals with justifying a lot of what's happening in these numbers, apart from just us talking. Let us point to those highlights broadly of what we have spent more on, and why, where there were savings, and what we did with those savings, how we redirected those funds, so that we can bridge the gap, a gap analysis, so to speak, Mr. President, of what we were expected to achieve and what we actually achieved. But, Mr. President, the leader of government business also spoke to the debt situation and the debt to GDP. And I think the time has come where, and I agree with her, everything is not politics, everything is not partisan political rhetoric. And it should not be when it comes to the business of a country. The truth of the matter is that you can use numbers and metrics to tell the story that you want. Both sides are guilty of that. You use it to suit your narrative. The reality is, Mr. President, that the government came into office 8 years ago, because this government is not taking office for the first time in the last couple of weeks. They've been here for a while. And when they came in, they made some adjustments, and they convinced Barbados that these adjustments were necessary, the debt restructuring, the default on the debt, etc. And they painted an extremely horrible picture of the economy. And while I am not equipped to defend the numbers that they came and saw, and I hope that some people who reside in the tribunal may use the opportunity to clarify a lot of those statements, not for the party, but for Barbados. Because when a government is in control and takes certain decisions, it must be able to be in a position to defend and explain to the electorate why they made those decisions. And that is why I'm saying it is about having a real, true, honest conversation with Barbados. It is not being partisan. It is not only about the Barbados Labour Party, Democratic Labour Party, or any other political party, Mr. President. But when they came into office, they made specific changes that impacted the lives of Barbadians significantly. We know, and I'm not going to dwell too much on it, but we know about the national insurance hit and what that means to our pension funds and all that, and the ability for us not have to work longer before we retire. All of these are real things. But, Mr. President, it was justified, the government was forceful. They came to Barbados, and to give them the credit, they explained why they thought they had to take these steps. The gross public sector debt at December 2019, after some of that reshuffling, after the write-offs, after some of the adjustments, the major adjustments that impacted our lives and livelihoods, the debt at December 2019 went to $12.3 billion. The gross public sector debt at December 31st is at $15.1 billion, Mr. President. Interest payments, Mr. President, in 2019/2020, in that period, 2019-2020, were at $249.7 million. Interest payments in 2024/25 was $750 million, Mr. President. So the realities are there. It is not about using metrics that change if you change how they are calculated and the basis on which you calculate them. It is not about that. The reality is that the debt has grown over the last few years, and the government is free to defend why they have borrowed more money. The reality is our interest payments to service that debt has grown in excess of $500 million as well. And one of the things that the government also did, Mr. President, is the government said that they're going to go and get cheap money. And they're going to be more financially prudent because they're going to get financing from cheap sources. And, Mr. President, again, in 2019, the effective interest rate based on the interest payments and the debt and the loan stock was around 2.03%. at the end of December 2025, Mr. President, that effective interest rate is now close to 5%, 4.97%. So, Mr. President, I just draw this information for persons to get a better grasp of where the country is financially and economically. And you would acknowledge that I also use the periods that the government was in office, and I didn't try to politicize my statements by trying to compare it to 2017 and 2016 and 2018 to justify if one government is better than the next. But the truth of the matter is that this is what we are faced with now. We are faced with more debt, we are faced with higher interest payments, and all of this is built in and feeds in to this estimates of revenue and expenditure and our ability to pay our way. Mr. President, the government has also kind of articulated to the country, they're using smart language. And they're saying that we are not in an IMF program, that Barbados is not in an International Monetary Fund program, and that the government has them a phone call away in a standby arrangement. I'm not here to dispute if the phone call is a local call or a WhatsApp call, Mr. President. But I will make it clear that the Barbados government, the taxpayers of Barbados, we have a relationship with the International Monetary Fund. Call it what you like, not in a program or not or out of a program. We have an existing relationship with the IMF. And that relationship, Mr. President, is based and will be based on our relationship, on our ability to repay the debt that we owe them. Mr. President, if you go and take out a mortgage with their bank, you have a relationship until you clear that mortgage and they pass the title deeds to you. There is a relationship with them because you are in an agreement to make a payment to them every month. We are in an arrangement to repay the money that we have borrowed, the government has borrowed, from the IMF. And that is all I want to make clear. And at December, that amount due to the IMF, based on what the document itself is saying of estimates of revenue in Appendix C, I believe, Mr. President, we owe the IMF at December 31st, $864 million, Mr. President. $864 million at the end of December 2025. We have a relationship with the International Monetary Fund. The government can fashion it how they want, but Barbadians must know that there is a relationship and that we owe close to $1 billion to the IMF. And you wonder why the government will say that everything is stable, the economy is growing, we are better off, that the GDP is coming down. But the reality is, again, is that amidst all of the angles to show that we are punching above our weight, last year, the government borrowed debt to repay existing debt, Mr. President. They borrowed, and we were here in this chamber debating that. We had to borrow $500 million to repay debt, of which a part of those proceeds went to repay the IMF. Mr. President, I just implore us to have a better relationship with the people of Barbados and put the facts on the table, and we are smart enough to make our own, to make our interpretations, Mr. President. It is not to offend the other side, but these are the facts, and anyone is free to stand up and to say that the numbers are incorrect, or to defend the numbers, or to even justify why they did this or why they did that. And that is what the debate is all about. It is not a fight, but I'm being totally genuine with you, Mr. President. I try to take politics out of it. And I refer to a period where the Barbados Labour Party restructured the debt, and I showed how they are managing the debt. Straightforward, Mr. President. They restructured it down to 12 billion, it's back at 15 billion. At the 12 billion, the interest payments were $250 million a year, approximately. We are up now to $750 million a year and going strong, Mr. President. And why is that important? Again, because that is taxpayers' money. That is part of the money that has to go out of the proceeds coming from the VAT and coming from our income taxes and coming from the fuel tax and all those different taxes that we pay, all the import duties that we pay, all the duties on the fuel that we import. So it's important. So the first thing, Mr. President, is I think we have to have we have to build a level of trust. And following off on trust, we have to build some accountability. And I've been sitting in the chamber for the last 2 years, and one of the things that have come up, and it has also had the attention of Barbados nationally, is the audit office. And there is an allocation for the audit office as well. And again, interestingly enough, when you look through the budgets, when you look through the estimates, when you look through the documents, right, the information does not allow you to have a critical eye, because it speaks very broadly on, for example, it speaks broadly on how many persons will be staffed in the department, but it doesn't speak to how many staff does the department actually have. So, for example, we couldn't lift up the estimates and say that, for example, in the Ministry of Education, there's an allocation for 100 teachers, but the ministry only currently has 90. That is something that we would need to improve. But in the case, Mr. President, of the audit office, Mr. President, we have learned in recent time by the leadership of that important department that there are 31 vacancies in that department. And the audit office is important to this process, because that is the office that comes down and says, oversees what has been spent and how it has been spent. And it gets into the nitty-gritty now to give Barbados and this parliament, because it reports to this parliament, gives us the confidence that the government is doing everything that is being done and is doing it above board. It is following the procedures, it has structure, there's approval process, there are tender processes, and that reporting is clear. That is the responsibility of the audit office, very important. But to have an audit office that has 31 vacancies in the department, but really only has 72 vacancies in all. So you're talking about 43% on the staffing in that department. And it was expressed on numerous occasions that it needs to be addressed. And there were solutions put out there in terms of how we address it. The audit office is really a group of young professionals, auditors, who have degrees in auditing, professional qualifications, designations, etc. And the private sector is kind of grabbing them up because they are offering more attractive remuneration packages, Mr. President. And I would have hoped that the government, especially I'm hearing this over the last 2 years from in this chamber, the government has been in office for 8 years, and they've been in opposition also, hearing these calls for the audit office, that we need to address it. The government needs to address it. The government needs to put more resources to ensure that we can staff this important department so that they can get on with being the watchdog for the government spending. It is very important. So I don't believe that in its current form, the office can even do its own hiring. So these are things that, again, if you're talking about numbers and you're talking about making sure that we are prudent in our spending, we should also be prudent in making sure that we spend how we're supposed to spend and that we don't mismanage the funds or misappropriate the funds. And one key measure to do that is to ensure we have a fully functional audit office. And we need to address it as a country, and the Barbados Labour Party needs to address it as a government. And it can be addressed. It can be addressed. We cannot allow the audit office to continue to be understaffed at these high levels. We're talking about 43% understaffed. How can they function? How can they audit the ministries? How can they audit the other departments, the SOEs? How can they do it? How can they perform special audits? And I say it is important, Mr. President, because we know the work that the audit office has done over the years through different governments. We know in recent history, yes, don't worry about it, I'm not going to get into it, but we know about the Hope audit, Mr. President. We know about the steel frame homes audit, but they also had audits in previous years, in previous administrations. The audit for the NHC, the high rise in 2016, the Transport Board in 2009, the Newton Business Park in 2007. So it transcends administration. It is important work, but they cannot carry out this important work if they don't got staff.
Mr. President, I raise on a point of order. I'm loath to interrupt the honourable member, but he is misleading the House. Mr. President, in the last sitting of this Senate, the honourable member, along with myself, sat jointly on the Public Accounts Committee, and we heard jointly about the challenges of recruitment for the audit office. We heard from the previously now retired Auditor General, Mr. President, that despite multiple attempts at recruiting persons for that office, the honourable member knows this because he sat exactly, but perhaps not in that exact space, but during the meetings of the PAC, he heard exactly from the former Auditor General what the difficulties were. It was not a government problem. It was that persons were not applying to the audit office because the remuneration levels in the private sector were different and more favorable. And so the honourable member is misleading the chamber by attempting to make this about the government not staffing the office. And secondly, Mr. President, the honourable member is also fully well aware that the Public Accounts Committee, if it had been constituted by he who has now demitted office over the course of the last 2 years, would have been in a position to receive some of the very audits that the honourable member has just spoken about. But the work of the PAC was deliberately impeded. But we've had the opportunity to treat to those things. And I'm hoping that in this term, we can.
Please continue, Senator Walters.
Mr. President, through you, I think the Senator Cummings really has just strengthened my position. We are aware, and she has also identified what is the cause of the issue. And the cause of the issue is that the private sector is offering a more attractive remuneration package. So we know what the problem is. So that means that the government should be able to address the problem, Mr. President. And how do you address the problem? By putting more resources at the disposal of the audit office. As simple as that, Mr. President. So I'm thankful for the support for the leader of government business on this matter, Mr. President. But Mr. President, I will tell you now that I came to debate not to get in a fight with the government. But the truth is that the facts cut deep, Mr. President, and the realities cut deep. But Mr. President, we have a situation, a recent situation, where the government or the government officials or a specific ministry is now defending expenditure of $35 $30.7 million for CARIFESTA. And why they have to defend this is because they settle on their agenda, and they say to Barbados, or they say to this chamber, or they put in the document that it will cost $4 million. If they had said that it would have costed $30 million, there would not be this discussion today. This questioning of how the money has been spent, and the ask for them to justify it. And that is the reason I am talking about trust, accountability, and a functioning audit office. Because now the trust is gone, Mr. President. And I am sure that the citizens of this country do not want to hear from any government official on the spending of the $35.7 million for CARIFESTA. That they would like to hear from an independent department, namely the audit office, to go and do a special audit on the spending of CARIFESTA. And today I call on the audit office to take time, their limited resources, and to go and do an audit, a special audit, on the expenditure of this government on CARIFESTA 2025, where it has reported that they have overspent $31 million approximately, Mr. President. So I am not just talking for talking's sake. That is why we need an audit office, because these things are happening. The audit office, Mr. President, told Barbadians in 2024 that the government set out to import steel frame homes at $27 million, and that the government overspent $27 million. This is serious business. We are talking about financing deficits of $1.1 billion in a year, $1.7 billion in a year, $700 million in the previous year, another $687 million, and we are wasting taxpayers' money. Every cent counts. So that is why I call for a functioning audit office. And I call for a special audit on the spending of CARIFESTA. And not only, Mr. President, the $31 million that had been spent that was not budgeted, but also the capital works projects, Mr. President. Because you have now a situation where I think it's $100 or $150 million have been spent on capital projects related to CARIFESTA. And Mr. President, you know what's the funny thing? Is that if you go to any one of those three facilities now, and you want to use the bathroom, there's either not a bathroom or a chemical toilet. $157 million, and not a permanent toilet facility in any of these infrastructural projects. So that is why we need an audit office that is functioning. This is serious business, Mr. President. You have a Richard Stout amphitheater. You have CARIFESTA House, and you have a structure at Newton. I don't know what to call it. The amphitheater was already started construction. Work has already been done on it pre-CARIFESTA. You have a temporary structure in CARIFESTA House, and you have a structure that you can't go in if rain falls at Newton. And you're looking down at $157 million. And none of them have permanent toilet facilities. Mr. President, this is serious matters when it comes to expenditure, comes to how we spend money. And we have to ask these hard questions, because it is not about taking the opportunity from the creatives. It is not about that. But it's about spending prudently. Could we have done it differently? Could we have done it more economically? That is the point. Mr. President. And to make matters worse, Mr. President, the Carrie Festa Village is a temporary structure. They want to make it permanent. My understanding is that they spent close to $10 million on it already, and that it needs another $15 million to be made permanent. So that's why I say we need to really get a little more transparent with how we are utilizing taxpayers' funds. And I know we have a Minister of Culture in here and in this chamber, and I hope that he can address some of these issues, Mr. President. I hope he can address some of these issues. And I don't think that the senior officials, and hold on, let me say that, Mr. President. But Mr. President, a lot of money is spent, and we need to make sure that the audit office is functioning. We need to make sure that we are being as transparent as we can, as prudent as we can, because every dollar counts. Because all the talk about world crisis and all that, there's still controllables that we have. We have controllables. Don't make it seem as though there's no controllables, and we are here because we are trying to control the government spending by saying this is what we are giving you to spend. So, Mr. President, I can leave it out. There's also another thing, Mr. President, that when you come up and you want expensive things, champagne tastes and moppy pockets. When you want big things and you got little money, but you got to creep before you can walk. The government had a big vision for Carrie Festa. Nothing is wrong with that. But we also have a lot of big problems in this country that needs to be addressed. So the priorities of the government need to align with the realities of Barbadians. And again, it's not to take away from the creatives. It's not to take away from those vendors that came and sold, those workers in the hotels where visitors resided and came in for the 2 or 3 days or the week. It's not about even those that participated. I hear about ticket sales and all these things. It's not really about that. It's about, could we have done it better? Could we have been more prudent in the spending? Could we have done it a different way that would have cost the taxpayers less? I'm sure that we could have, Mr. President. Mr. President, in these estimates of expenditure, there's an allocation, another allocation. Now, I'm trying hard to stay away from the regathering allocation because we do not know how that money is being spent either. But there's another allocation that we need to keep our eye on, especially coming out of the fact that we moved from 4 million to 35 million for Carrie Festa. And that allocation is the 60th anniversary of independence and the 5th anniversary of the Republic suite of events that the government is planning. We need to make sure, Mr. President, that this is not a placeholder like it was for Carrie Festa, and that at the end of this 12 months that we are hearing that it was not $3 million, that was just a placeholder, it's actually $25 million. The government needs to do better and should do better. There's no excuses why, at this stage, with all of the experience of government in this current term, previous current terms, that we should be in a position, or this government should be in a position, that they're putting this kind of placeholder on the budget or on the estimates to be approved, knowing full well that they will exceed it. If this $3 million is not realistic, please adjust it and let Barbadians know. It breaks the trust, and it makes it hard for the government and any government to continue to do work on behalf of people because they just don't believe what you say you can do, you can do. So, Mr. President, as we come into the actual expenditure of the government, the planned expenditure for the next financial year, one thing is to approve funds. One thing is to disburse those funds or allocate those funds. But the next thing, Mr. President, is to make sure that we do not mismanage the taxpayers' money, to make sure that we execute the programs with little variation to budget, especially capital works. Because when we do this, we are losing the ability to deal with the real issues that we have in the country. And I'm going to put it in context so that the chamber can understand what I'm saying. When you have a situation, Mr. President, and I have used a few projects that where capital works or money has been spent, and there were either overruns or mismanagement of funds. And if you hear the amount, when I total these projects, Mr. President, if you hear the amount, the totality, you would be shocked, and you would ask yourself, what could the government have done with these resources? $60 million on hold, Mr. President. Overruns of $27 million on the steel frame homes, Mr. President. The $20 million that was spent to import prefabricated wooden houses from Guyana. Carifesta at $181 million or so, depending on the final number for the capital works, Mr. President. The money we paid to White Oak to restructure is $54 million. The slogan for the BTMI, the fee for the slogan that we could not use was $750,000, Mr. President. We paid at least $200 million, I think, in the facility at Harrison Point during COVID that is now housing workers for a construction site, Mr. President. And if you total those numbers, you're close to $600 million. $600 million. And you have to ask yourself, could we manage this better? If we had managed this better, what could we have done with maybe the $400 million that would have been left? Or the $300 million? Would we now have to go and get a debt swap? Would we now have to go and finance our deficit from outside of Barbados using US dollars, Mr. President? So the financial management has to come hand in hand with this discussion on revenue and expenditure, primarily expenditure, how government is spending and what they are doing with the money, how they're spending it. It's important, $542 million across those projects. And again, this is not to say that it has not been this, it was different in different administrations. I'm not here to suggest that this is something new. And people kind of get accustomed and say, oh, this happens all the time. There's always cost overruns. There's always mismanagement, but should it be allowed to continue at this level? It should not, regardless of which government is in office, Mr. President, or which party is in office. But, Mr. President, these numbers are significant because when you're talking about close to $600 million, you're talking about 6 months of our VAT intake. You're talking about 6 months of our VAT intake, Mr. President. You're talking about more money than we take in income tax on an annual basis that you're wasting, that you're mismanaging, that you have not used them to reallocate to critical spending in the country. Very important, Mr. President. And I trust that those listening will take it how I'm really bringing it to you, because it is not about being partisan. It is about you have the affairs of the country to handle. You have all of the money to spend on behalf of the citizens, and you must do a better job as the government. You must build trust, you must be transparent, and you must be held accountable for those monies. Mr. President, again, we look at this whole issue of trust and accountability, plans and projections of the government, what they say they would do and what they say they wouldn't do. And we look at energy costs. And I know that Senator Cummings gets very passionate when you speak about energy. And she will get more passionate when you speak about health going forward. But the reality is that I sat and listened to her presentation about health. And had I been a person not paying attention to debates, not listening to the government spokespersons on different issues, I would have been extremely impressed, Mr. President. I tell you no lie. If I was a class 4 student at Dickens Primary School or St. Stephen's Primary School, I would be impressed. If I was a 5th student at Queen's College, I would be extremely impressed at the speech. The plans for the healthcare sector, the health system committee. But why I'm not impressed, Mr. President, is not that because it wasn't a good speech, but because we need more than good speeches to run a country. I sat in here and I sat outside of here, this chamber, and I heard good speeches on where the country was going and where this government was taking the country as it relates to energy, as it relates to transformation to a renewable energy economy. And where we were in 2019, Mr. President, we are almost the same place in 2025, 26. The reality is that the minister or the foreign minister will say we are far from, as she just whispered. But we in the community, we outside of this chamber, we do not feel that far from. We do not. And Mr. President, in 2019, the fuel import bill was $728 million. In 2025, Mr. President, the fuel import bill was $728.5 million. Now, the cost of fuel will impact on this number. But the reality is that we are paying the same levels every year for fuel, amidst the transformation that was supposed to happen. And that through numerous speeches, we were told better was coming. Specifically, Mr. President, as it relates to power generation, in 2020, heavy fuel oil imports in barrels stood at 1,053,062 barrels. So Barbados imported 1,053,062 barrels of heavy fuel in 2020. In 2025, Barbados imported 1,105,488 barrels of heavy fuel, Mr. President. And that is used to power electricity, Mr. President. Approximately, I think 90% of that is used to power electricity. The point I'm making, and I'm sure you get it by now, that we have not even caused the date there amidst all of the hopes, all of the fancy speeches, all of the lofty targets that the government has set. And we are in a position now where we are having to navigate the international pressures, which we would have to in any circumstance, but we are pretty much at square one, where we have to do the same initiatives that we were doing back then to kind of combat the increases in cost of living. I'm not knocking the increases or the initiatives to try to address the cost of living. We need to ease. Let's see if they work or not. The point is, the government has not moved the needle. And that is a significant cause of concern, Mr. President. So as I said, it is more than talk now. The election is over, so to say. It is time to get down to serious business. It is time to get down to serious business. And that business is making sure that your plans are executable and you can execute them and that business can feel that something is happening. We don't feel nothing is happening right now, Mr. President. Not when we hear the interventions of the government to try to control the price of electricity, Mr. President. We ain't feeling it. Not when we look at the numbers that the fuel import bill is the same. We're importing more heavy fuel oil than we did in previous years. We're not seeing it, nor are we feeling it, Mr. President. And I caution the leader of government business because the government's policy has run them and taxpayers in a trap and investors in a trap where you have, I think it's $500 million trapped, of investment trapped with no return. So I just hope that whatever we're doing, she's doing or spearheading in the medical space, she does not run herself in a trap. And that she's very focused on being practical and realistic, one step at a time, bite for bite. And this is me being genuine now. No. I mean to her, specifically to her. I want her to know that this is Senator Walters saying, I want you to succeed. Because if she succeeds, Barbados succeeds. And I'm saying to you, Mr. President, that the amount of money that is at her disposal and the amount of money in the Ministry of Health, the amount of money that she has raised in terms of additional expenditure in the hundreds of millions, make sure what they are doing is practical and can work. Because we are in a dire situation now where what they promised for the energy sector has not come to fruition yet. That's all I'm saying. I'm not saying that that is the reason why she was moved or shifted to another ministry, Mr. President. I'm not saying that. I'm not saying that she cannot solve those problems, but she should be given more responsibility. So it could leave the mind confused, some of these decisions, Mr. President. But Mr. President, one of the other issues as relates to energy, and I think it is one now that we need some of the technical people to really deal with. We need the Minister of Energy to address it, is because I think we were made aware that there are new agreements with the Barbados Electric Power Company Limited. And other entities outside of the chamber and persons and senators inside of the chamber and individuals outside of Parliament have also raised the question of what are the details of those agreements. And that is important. What has the government signed on to that will commit taxpayers on one hand and then commit consumers on the other hand as it relates to an electricity bill? We need some transparency. And that is what I preface my contribution on, being transparent. Another idea, another initiative, Mr. President, where we've been locked out of information. Investors locked out of the grid, and consumers locked out of the information. I'm not sure there's some legal authority to withdraw or withhold, that critical information details of those agreements. But I would hope that those details can be shared with the public of Barbados, Mr. President, because the government acts on behalf of the public of Barbados and not on behalf of the Barbados Labour Party. Mr. President, a question in passing also is that in terms of the relationship with Emira, someone sent me a few weeks ago, actually during the election, I was sent a clip, a YouTube video that said that pretty much that another Caribbean territory that Emira operated in, fully owned the power plant down there, was signed a memorandum of understanding to acquire ownership of the power company in that territory, which means then that only, I think Barbados would be the last Caribbean country that they'll be wholly owned, and they still have an interest in St. Lucia, I think it is. But the point I'm making is that I'm not sure if that has any long-term implications for us in Barbados. And it may be useful for the government to share if there is some long-term implications for us as a small island operating under EMIR, given that circumstance. As I continue, Mr. President, on energy, and I have to raise the issue of the prices at the pump. And again, initiatives were put in place to reduce the impact of the cost of gas and diesel at the pump for consumers. I don't think that is an issue to debate, but the issue to discuss is when can we finally get some transparency in those transfer prices at the pump? And that is what Bajans are asking for. We understand that the government can do only so much to cushion them because of the international pressures. We understand that. On behalf of the people of Barbados, we understand the government can only do so much. What we want now is that we want to see how that cost is made up and how that cost changes, Mr. President. And I tell you why, with all of the faces looking a little confused. You know, Mr. President, that I sat in this chamber and there was a period in recent history where for 18 months, the price at the pump did not change, Mr. President. Although the price of oil internationally was significantly reduced and declined month to month, close to 25%. And we continued to pay $4.22 a liter at the pump for 18 months. So it is not only the initiative, it is show us how you are getting to these numbers and why we must take them, because that is not fair. We don't want another situation like that, where we see that the government has made an attempt to cushion us, but then we see some, it looks as though, let me say it that way, it looks as though there has been some abuse of that attempt by maintaining prices at a high level, even although the oil prices internationally are coming down. So transparency is needed in this department. Be transparent. We know that there's duties, we know that there's VAT, we know that there's some recovery costs now for the BNECL. We know these things, but be a little more transparent with the numbers. What is the cost we're getting at, what those duties are, what those taxes are, etc. So, again, it is just for the government to be a little more transparent, to be a little more accountable with the finances and with the treasury. And that's all I think people are asking for, especially in these times when, in some instances, you can only do so much. So, Mr. President, as it relates to the priorities of the government, and again, I think that the government must accord priority where priority is needed. And you can see priority being allocated to special areas. Healthcare is one, education is the other. Minister alluded to it before. And as it relates to health, these are the realities. It seems as though we cannot only throw money at the problem. It seems as though there are deeper issues in the system at the QEH, that some of them may not require financial intervention. But those that are involved might be able to address these in a more comprehensive way. But it seems so to us, because why I say that is that taxpayers have put a lot of money at the government disposal already. We have also committed as workers to what I will refer to as a QEH tax, which is the health levy. But it's a QEH tax because every year the National Insurance then writes a check to the QEH. So I call it a QEH tax. So we are paying substantial sums every year. Since 2018, we've been paying the QEH tax, which is maybe around $80 million a year. So significant amounts of money have been allocated, directly and indirectly. but we are still hearing of the recurring issues at the hospital. And it is not to say that there's not been an effort. We saw the QAH has been, the accident emergency had a facelift. We heard about procurement of critical equipment. We hear about the expansion of the QAH. But it doesn't take away the actual realities of what we are facing when we go to the QAH or to the accident and emergency. And that's just the reality. So there has to be a marriage between now what the government spends and what taxpayers are putting in to the QAH and what they're getting in return. And sometimes we look at the big things, but it might sometimes be the smaller things. Sometimes we look at more the financial things, but sometimes it might be the non-financial. But the point is that we need to really address it. We cannot continue to have occurrences where persons are in A&E for days, where videos are coming out with persons laying on the ground, where the Prime Minister now has to take a visit to the hospital. It is not fair, it is not acceptable in 2026 when we've thrown or allocated so much money to the QEH. As I said, indirectly through the estimates, but directly through the health levy. It's a substantial amount of money. Mr. President, there are some things that the government probably can think of and can do to ensure that there is seamless service to patients in the accident and emergency. And we just need to do them. I will leave the experts to say what they are, because I don't want to get bogged down with the technicalities of what is happening or what isn't happening, but I'm sure, and we have a senator here, I'm sure will deal with this in length, but I am sure, Mr. President, there are things that can be done. I was out last night, and on my way back in, I saw on my WhatsApp that there was a shooting in St. Lucie, and that 9 persons were shot, I think, and 1 person was dead. And 1 person was dead. And the first thing that came to me is that the accident and emergency department will have to be locked down. And what will happen now to those persons sitting in there waiting for care? So you have situations where you can almost calculate, or you can almost say, this is your problem already, and we need to have intervention where we say, this is how we solve that specific problem. Because the person that has an issue, an emergency, a person has an emergency should not be put on the back burner because crime is out of control, and we have now to facilitate those persons coming in from shootings, etc. I'm not saying they should not be facilitated, don't get me wrong. They should be facilitated, but not to the disadvantage of those sitting and waiting. It is an example of a real scenario that plays out. But how do we solve these particular issues is what the public will want to hear as well. So I get it, Mr. President. I get that, as Minister Kamil said, that she visited all of the facilities, Mr. President, and that they're going to have health system transformation. I get it, that they're going to have a transformation committee. But again, don't let us get carried away with what sounds good and fanciful. Let us get our hands dirty with some of the real scenarios that confront us every day and see how we can attend to those immediately. Because from the looks of it, the crime is getting worse. Unfortunately, that is reality. Unfortunately, that's the reality. Only a couple of weeks ago in Deacon's Farm, a gentleman was shot. You know where he was shot? There's a senior man sitting down by a shop where he will wait to drink a deputy beer on the evening. So crime is not under control. It is out of control. But as it relates to my specific point, we need to address these different scenarios, and there are many, I am sure. There's a situation, Mr. President, where the operating theaters, I understand, is always an issue around them. I understand that. I don't think I understand that only 3 out of 9 are functioning at present. Again, it is just some information that I got, and it can be clarified. But I'm saying these are issues that continue to prevail, and we need to kind of get on top of them. We can't be spending $500 million here, doing the debt swap and get $300 more million, that's $800 million, getting out another $80 million for the taxpayers from the National Insurance Scheme, and still walking in the A&E and go sit down for two days before somebody sees you. No, it is not acceptable, Mr. President, not in this day and age. It is not acceptable. So, Mr. President, I commend the minister. I wish her well in her transformation. But I think we need to really focus in on the scenarios and attend to those scenarios that are really important to the patients in the clinics and at the QEH. And we talk about schools and spending. And what frustrates me, Mr. President, is that, again, I calculated numbers. Now, you know this by now. I calculated close to $600 million in either wastage or things that could be managed better. Not to say that $600 million would go away, but there's opportunity in that $600 million, maybe even half, that the government could have put to better use. And school infrastructure is a better use for some of those resources. Every week, or almost every week, there is a sickle, a rodent infestation, some issue at either primary or secondary school in the country. And I try not to exaggerate. It happens very often. And if it is not an actual sickle, the problems are still there. So although the staff doesn't have to go home and the students don't have to be collected, it doesn't take away the fact that there's still mold in the roof, and that there's still rodents coming through drop-ins every other day in the classrooms. So because the school is not closed doesn't mean that those issues are not prevalent. They are. But what can we do and how can we spend our resources better to address these significant issues? Mr. President, a lot has to be done. And a lot of money is at the disposal of the government. On my last speech, of the appropriation bill last year, I spoke about the sums of money that the government collected since 2018 to 2024. Significant amount of sums. I think it was close to 25% more than the previous government in revenue. A lot of money. The government now is estimated to collect over $1 billion more in revenue. It means that it will have more money, but the more money should be doing better things. We should be feeling the more money. We should be. As taxpayers, as citizens. So the maintenance of the schools, and I think we need to rebuild some of those schools. We're rebuilding polyclinics. We need to rebuild some of those schools and repurpose those schools as well. And again, it comes now with collaboration of ministries. You're talking about a government that said they're going to build ministeria in every constituency or parish. Can't remember exactly, but they're going to be building ministeria. But we also have situations where there can be collaboration with the Ministry of Education, for example, that where there are schools that have facilities of playground, that those are the ones that are transformed because the students will use them. And then after hours, other people can use them, or weekends, clubs can use them, etc. But what is wrong with rebuilding some of our schools? Why are our schools being put on the back burner? They're being put on the back burner with all of the issues that we have in the school system in terms of the plant. They're significant. Last week, I think there were 3 that we know of. But those issues do not just go away because school reopens. they continue to fester and fester. So how can the government use its resources to attend to these critical issues? We have to address it. And there's some softer issues in education. The indiscipline in schools is growing. There's a lot of talk around the grooming policy, how students look when they go to school. I think the minister in August last year, early last year, promised that he would address the grooming policy and that he would kind of find a middle ground to letting persons express themselves versus letting persons have a little sense that they're in an institution that have rules. But we have not heard anything since. I understand that even last week at the secondary school, there was a big, I would use the word cuss out between administration and parents because of a color of the hair of the student. There are too much gray areas, Mr. President, and it causes conflict. Rules are rules. Make the rules that they can be understandable by both parties, that you can draw the line, and that the school administrators have the power, and they have the right and the authority to do what they have to ensure that students follow the rules. But we can't have a system where it's a free-for-all. So all of these things, Mr. President, are important. And you were asked, why is this important? Why does how somebody wears a pants to school important? Or if the length of the pants, or even how tight it is, Mr. President. I wear some tight pants sometimes, Mr. President. I see you in skinny jeans too, Mr. President. Nothing's wrong there. It's always inappropriate.
I have the legs for it.
But I'm saying there's nothing wrong, but we have to determine what is wrong from versus what is appropriate. There's a difference between what is right and what is appropriate, right? So we just have to draw those lines. But what is concerning to me is that we have a lot of young men and women that may become, that may be misled in thinking that what they do in schools is acceptable when they leave school. And that is one of the biggest things that we have to control and manage. Now, I remember in the days going job hunting. As a young boy, you go job hunting, you have you print out your certificates, you got all your CXCs and your FUSCs that you got some ones and twos in there. But you got your certificates, and you go to the job, but you have on your church shoes, or church pants, and nice button-down shirt from S.Y. Adam back in the day, for me. And you go, and don't matter what type of job, you were dressed in a decent manner. Because your role was to impress your potential employer and to make them want to hire you and give you a job. Well, those things have changed. You have persons coming to interviews now in slippers, no belts. It's called the straps. Senator Trim was called the spaghetti traps. Spaghetti traps, Mr. President. So, in other words, do they believe that because there are not strict rules in the school system, coming out of school, that there are not rules in the business space, that there's not a way to conduct themselves? I'm not blaming it fully on the system, the education system and the government policy. I'm saying we have to look to see if there's a spin-off, because how we allow persons to feel that they can do anything, anyhow, anytime. So, and the thing is that a lot of them lose the opportunity of getting a job because of this, because of how they present themselves. So we have to do something. We have to mold the young minds. We have to direct them. We have to put things in their heads early on what is right, what is wrong, what is decent, what is appropriate, what is inappropriate, so that they can also make the right decisions. So the government policy is not something to shake your head at and say it will fall into line. It is something that the government must enforce, must be clear on, must have clear guidelines that both parents, pupils, and the administrators of the schools know and can interpret and understand. We had rules when we went to school, Mr. President. We knew we could not wear our hair a certain way. We knew we could not wear our parts a certain way. And if we wanted to do it, you had to ease and do it after school. You could not do it inside the school. Furthermore, you could not even leave home with your parents seeing you a certain way because they knew the rules as well. And they would not allow you to go to school if you were not following the rules. So when there are no rules, parents, it's not that parents want to be disobedient and tell the students go however they want. But if there are no rules, there's nothing to follow. There's no benchmark. There's nothing to pull back. So it's very important, Mr. President, that is attended to specifically very soon. Mr. President, housing. Now, I was given the honor by my party to speak on housing over the last 2 years. And we know that there was a lot of mismanagement in the Ministry of Housing based on the reports coming out from the same or the office that I referred to earlier. I am concerned that the government will take an approach that they will continue in Hope Inc. as an entity. I listened to some of the discussion when the Ministry of Housing was in the well of Parliament. And the Minister of Housing opened his remarks by signaling the intention to continue in Hope Inc. That is not a good sign for Barbados, because they do not have a good track record in the short time that it existed. Why would you continue to support, to fund a housing program through an entity that has mismanaged the resources? And the mismanagement is not from me saying it was mismanaged, it was from the Office of the Auditor General, who said that these were key things that we should have been concerned with Hope. But the government has taken a position that they will discard that and that they will continue in Hope. And what are those key things? I just have a few things just to remind the Chamber and the people of Barbados, because it is important and it is significant enough, because it was $60 million. Again, there's a lot of money. There's a lot of money. A little more than I carry fast the bill, but it was a lot of money, Mr. President. The admin costs, the audit office said, Mr. President, that the administrative costs in Hope moved from a budgeted $900,000 a year to around $4 million a year. It said, Mr. President, that that entity, the management of that entity, committed $64 million of taxpayers' money when they had no authority to do so. It said that that entity, Mr. President, committed to spend $37 million more to use an industrial type of construction versus using the traditional type of construction. $37 million more. It said also, Mr. President, that the entity was charged then with some level of importing prefabricated wood houses from Guyana, and that every house erected, the government stood to lose $125,000 per house. Mr. President, a board house, let me put it in Beijing parlance, the government is losing or has lost $125,000 for every house that came in from Guyana. Every wooden house. That is under Hope. So the track record is not good, Mr. President. So I'm saying, if the track record is not good, why would you continue then to funnel resources, taxpayers' money, down through Hope to execute a mandate? The government said they would build 2,000 homes a year. Hope built 110 at that time of the audit. We still see the buildings in Poole St. John unfinished. Still with the same title issues. So instead of arresting the issue, instead of bringing the confidence of taxpayers into the government, no, I say that we have an issue here. Hope did not work for us. We can done away with hope. And we are going to do this through a National Housing Corporation. We're going to put this in place, that in place, better project management, better committees, better everything. We're going to train small contractors so that they can improve the standard of building, they can be more cost efficient, etc. We're not hearing that conversation. We're hearing that we're going to use hope again to just put a whole set of money. And you know what? We know what's going to happen because hope has no record of success. It has a record of wastage. And some would even say it's condominium, but it will stick to wastage, Mr. President. That is reality. So it is fine to come and explain how excesses in departments will move from one department and might be used in another department, etc. And some fanciful about how the government will manage its affairs. But these are the details. This is the reality now. This is the reality. And low-income housing is one of the most important things, though, for people. You have 3 or 4 generations of families living in a house. Why? Because it is expensive out there to go on the market in that way for land and house. The government has the mandate to provide affordable housing, not cheap housing, affordable housing. And quality affordable housing. But you can't provide quality affordable housing in hope with this record, which is a horrible record in such a short space of time. The next thing, Mr. President, is that, we come here, we debate, and we put systems in place. We talk the key legislation that will oversee how the government is run, etc. And you know that I have not seen an audited financial report from Hope since it was formed. I have not seen one. I wouldn't ask if you've seen any, but the reality is that they have not been produced, Mr. President. So you have an entity where all this money was put into. You had the audit office going in and saying, hey, something here isn't right. You have no financials for the years that you're operating, but the government continues to dump taxpayers' money into it. Something is not right, Mr. President. It must not continue. And that is why people are losing trust with with politics in general, because of some of these things, some of these decisions that are being made. That is why. The reality is, Mr. President, I will continue. But the truth is that people are losing hope because of activities like this. Hope is a disaster, but yet you allocate more money and you're trying to tell people that you are going to deliver homes through hope after the record that they have. But the government and the senators on the other side, they are sucking their teeth. And it has to be what I said. You are in charge of managing the affairs of the country. You have entities that are mismanaging finances. And you can't understand that simple analogy that you should not continue with hope. Hope need to be wound up. Cannot continue with hope. Not after their horrible record of wasting taxpayers' money and not providing homes. So it's nothing to suck your teeth about. So, Mr. President, as it relates to housing, government is supposed to deliver on affordable, low and middle income housing. But I think that government, there's some opportunity for government in this whole scenario. Government has just said that they will move to, is the right to own? And they have a fancy term. I like the government, they come up with all these nice terms. It sounds really good. Social mortgages, huh? I think that's what it is. A social mortgage. Like the concept. A person owns the house from outright in terms of the start of the mortgage, and they own the property. They have rights to the property, not own, but they have rights to the property, can hold it as security, etc. But government in general has not had the best record in providing low-income housing or affordable low-income housing. They overspend, as I said before, as I showed you the facts. And the housing then might be affordable to the person that is going to occupy the house or the family, but it then becomes a burden on the taxpayers because there are overruns. It costs more, but obviously the persons can only afford so much. So there's always a shortfall that the government, and then by extension, taxpayers now have to fill. And there's room for that, but there's also room to release some of that responsibility from off of government. And the government has the one thing that people really want, and that is the land. And if the government can see it fit to allocate some land so that persons can procure the land themselves and do the building. And it will still be affordable for them because obviously the land will not be sold at market rates. It will be sold at the same concessionary rates. The government will save a lot of money because to build a house for $125,000 more than it was intended to be built doesn't benefit the government. It benefits the person who's going to occupy the house. But we can build them better if we give some options where they can get the land and they can build the house. It has savings on the land, which means they have more money to contribute to the construction of the property. And there's an opportunity for that to happen. So the government must not only see itself as one that has to build the houses. It has to be a hybrid. There has to be some facility that the government can allow low and middle to low income earners to acquire land at reasonable rates so that they can pursue the housing for themselves and their families. It is not unrealistic. I'm sure it's been done before, but it's something that needs to be looked at. There has to be a marriage between how government can manage its limited resources to really house Barbadians. But I sense that using one method only will be overly expensive and inefficient, as we've seen in the past. Because as I said, we were promised 2,000 homes. I don't know if we got 2,000 homes over the last 3-4 years. It's 6,000 to 8,000 homes. I don't know if the government built even 1,500 homes themselves. So it's not sustainable, it's not realistic. Mr. President, in terms of crime, as I said, we've had examples of crime up to last night, recent criminal activity, lawlessness, and I don't think this is one of the more comprehensive discussions where it doesn't rely only on a court, doesn't only rely on the school system, doesn't only rely on parenting. It is multifaceted. It is really multifaceted, and we need to deal with all the different issues that intertwine that will address crime or the rising crime rate in this country, especially the use of illegal firearms. In the estimates of expenditure under the Ministry of Legal Affairs and Criminal Justice, I see there's an allocation for the National Crime Prevention Program, $11.69 million. I see $2 million as grants to individuals and nonprofits. I also see that 65% of that is going to operating expenses, 7.5 million out of the 11.6 million going to operating expenses. This is one of the ministries or one of the departments or one of the projects within the ministry that the government needs to understand what is happening here in terms of the distribution of these funds. What do they mean when they say operating expenses? What do they mean when they say grants to individuals and nonprofits? How will this department, this National Crime Prevention Program, how will this department function? What is the mandate in the short term, medium term, and long term? Because we need to address crime, and this seems to me as targeted intervention. So if it is targeted, they should have a discussion with Barbados on, for the next 12 months, this is what you can expect in these programs. This is important enough and significant enough that we can get down to the details with this program, Mr. President. Very important. We also speak about the fact, and you always know that prevention is better than cure, Mr. President. We heard it growing up again. Prevention is better than cure. So we got a lot of guns, Mr. President. Not bringing all the politics into it, but we have scanners at the port. We heard that when the government came in, they had to invest in scanners. That was fine. What percentage of containers that come through the port are scanned? What percentage of containers that leave the port are scanned? What are the analytics on the actual process of scanning containers, of intervention at the port as relates to detecting firearms? Also, Mr. President, I have not really heard from this ministry and this, in terms of addressing crime and the root cause of crime, which obviously has to be now the access to guns. What are the new technologies out there to detect guns? Are we looking at that? The scanning the containers seems to might be an old way, might be effective to a point, but what are the new things, the new technologies out there using AI and other technologies that can be put in place, investigated, researched, that we can bring them to bear? Because at the end of the day, we got two issues. We got increasing lawlessness, and we got increasing access to guns. And two of them are the type of guns that we're talking about too, Mr. President. They're spraying, not pop. They're spraying now. If you're in the region, they can get hit, as is the case that I spoke to in Dicker's Farm. If you are in the area, you will be hit. If you are a school boy or schoolgirl walking home that evening, you would have been hit. So what are the new technologies out there that the government can put a team to research, to come up with, to see how we can address guns that may come down and that may be being imported in parts and stuff like that? We have to get technical with this one. We have to understand in detail what are the things we can do to address it. And this gives us the opportunity, coming under the whole idea of crime prevention, seems more like a social program, etc. But what are we doing now from a technical perspective? How does this then intertwine even to the Ministry of Industry and Innovation and Science in terms of the technologies out there and stuff to address crime? Very serious, Mr. President. We need to put our resources behind ensuring that we reduce crime, we bring it down, we arrest crime, we have productive citizens, and we have a judicial system that works. I don't think there's any dispute around the amount of money being allocated. Some may say that is not enough money. But the point is that we just need now to do the things that we need to do, the small things that can have a great impact. Mr. President, the small business sector, I think it's very important to the economy of Barbados. And recent studies, I think studies a few years ago showed that I think 92% of the businesses in Barbados were micro and small businesses. They are significant as it relates to the benefit that they have and the spin-off they have to the contribution to the economy, for employment, to spend, etc. The government has the Trust Loan Fund, and I think we can commend the government to put in an initiative that would give some seed financing to a group of persons that would not have otherwise gotten a startup capital. But we also have to look at how do we make that whole system, that whole architecture of supporting small business better. The Trust Loan Fund, as I say it now, it provides some financial resources and some technical support, training, etc., in order for you to qualify for the loan. What are the bigger structures that we can form outside of a one-day seminar that can support an existing business longer term and more sustainably? I think I heard talk about using satellite locations with select services, etc. I would want to preface that by introducing a concept that I spoke about last year during Small Business Week, which is an entrepreneurial hub, which are facilities that the government can put across the island that will actually service small business in a big way and a sustainable way, providing a lot of technical support, a lot of secretarial support, a lot of accounting, financing, management, social media, a lot of support that will allow the business to carry on, allow the person to focus, the small business owner to focus on the business, and allow also the business to grow from strength to strength. I think that the government can put resources in a system like that. We need to support our small businesses. The younger people are more focused on working for themselves now than they are going for an interview. Oh, sorry.
Mr. President.
I want to rise.
I rise on a point of order, standing orders 32A. Granted, I'm new to the House, but I am one who seeks clarity. As much as Senator Walters is indeed my friend, I'm querying under the circumstances of which he has gone beyond an hour to speak. Now, I recognize that 32A acknowledges that the opposition senator has the opportunity to speak for 2 hours. But by virtue of all that has been presented in this House, and on the screen itself that has gone out to the media, it says that he is an independent senator. I'm not sure if you have exercised discretion. And sir, I will submit to you in that regard, but I do seek some clarity on the matter. I am a bit starving at this point.
Indeed. I received recent advice from the Clerk of Parliament, on which I'm guided, that the purpose and intent of the appointment of Senators Walters and Goodrich was to have opposition representation, and therefore, in terms of the application of the Standing Order 32A, that they represent opposition interests in the same way how with the independent senators or other independent senators, there's mention, for example, of persons representing commerce, religion, education, and therefore the intent is for opposition interests to be so represented. I'm guided by that research and advice, and that is the action I've taken based on advice that has been rendered to me in the past of the last few days.
Thank you, Mr. President. In other words, don't worry about the screen, everything is in good order.
You can correct it though,
Yes.
don't worry.
You can correct it? Okay, good. Thank you, Senator Snooker. But Mr. President, the small business sector, as I was saying, is important. And we need to hold our small business people close to us, nurture them, develop them. So the infrastructure of an entrepreneurial hub or something of a kind of that similarity to support them, because it is one thing to give somebody money, but then it is the next thing to leave them out there on their own. Money in itself cannot guarantee success for our small business people. They need a substantial amount of technical support and know-how to be able to succeed and maneuver this economic environment. In addition, Mr. President, the increase of the funding for small business moving from $10,000 to $20,000 is something that on the surface is commendable. But again, I ask the question, could it be done in a more, in another way that is beneficial to our small business people? And what do I mean by that, Mr. President? Small business people, any business, whether small, medium, or large, needs access to cash almost all the time. So I think the time has come for us to recognize that and look at the small business sector and the trust loan financing with that in mind. There can be a combination, Mr. President, of funding of cash, a cash loan, and there could be a facility where part of the funding can be a revolving loan or what we call a credit line. What that does is that it gives a certain level of cash to the business all the time, because as you know, as we draw down or as you draw down on the fund, you're using the resources, As you pay it back, you then have the resources again at your disposal if something comes up. That is what small business needs. Small business needs access to cash. Cash is king. Mr. President, you know all of these things. Cash is king in any type of business. A business that might be a medium-sized business, their goals are to become a large business. So they're going to be doing things that even the cash that they are generating cannot even sustain. So they are able to go to the bank to get a credit line, they're able to go to the bank to get credit cards, etc. But a small business does not have that ability. So if the trust loan fund is providing facilities for small business, we need to look at that sort of hybrid arrangement where you may give a fixed loan, but then you can also give a revolving credit, a revolving loan line of credit that will always have that small business person having access to financing as they continue to work and grow their business. On the small business, Mr. President, I am happy to be joined in this chamber by persons from the cultural industries, Mr. President, persons themselves who I saw on TV last night talking about crop over and the cost of costumes and how exciting their band is going to be and how they have a new addition to their band in the form of a 4-day band. So I'm excited to be joined by other members, Mr. President, who engage in specific activity within the cultural space. For some time, Mr. President, the entertainment industry has been unfair to small event promoters. And I use the word unfair because a small event promoter is a small business person. The threshold for VAT, to register for value-added tax, is if your business is earning more than $200,000 a year. I cannot speak to the earnings of my fellow senators' investment or initiative, but there are a lot of small event promoters who are earning less than $200,000 a year in revenue. The government in this budgeting process has moved that from $200,000 to $350,000. In other words, a business does not have to think about, a small business does not have to think about registering for VAT unless it earns at least $350,000 in revenue. There are small promoters who are earning less and who will earn less than that over a 12-month period. But for some reason, all event producers are supposed to register for VAT. That is unfair, Mr. President. And why it is more unfair, not only because they're a small person and there are rules for one set of persons and not the others, is that in a VAT environment, how VAT works, VAT is an offset tax. So what I get in VAT intake, I get an offset from my expenditure. And then there's a net position that I would pay the government or the government will pay me. As a small event promoter, there are also being serviced by small businesses who are not registered for VAT. So in other words, there is no offset of your revenue that you have to take in. So when you, essentially what a small event promoter is doing, he has to take 17.5% of his revenue and give to the government. And that is unfair, Mr. President, for those who are earning less than $350,000 a year. That needs to be rectified. So, Mr. President, we have to bring a level playing field for small businesses and small business owners and those who are aspiring. And that is one of the ways, I can only talk about what I know, and that in the entertainment industry, the small event promoters, that is what they have to go through. And it needs to come to an end, Mr. President. Again, it doesn't cost the government anything much to do that, other than the fact that these businesses will thrive, they will continue to use the services of other small businesses. They will turn the entertainment industry from a 3-month industry to a 12-month industry, where persons feel comfortable that they will not be run down by the VAT office. It will go a long way for small business people, for small service providers in the industry, and for families, Mr. President. How much more time, Mr. President? 5 minutes.
5 minutes.
Mr. President, before we wind up, Mr. President, I will just focus on the agricultural sector. And again, it's priorities of government. It is how a government sees or sets its agenda. We are in a situation where, yes, we have to import most of what we use or what we eat, etc. But we do have an agricultural sector, and food security is important. What are the resources afforded to the agricultural sector in this incoming year that will see it flourish or that will get them a little more comfortable? There are pressures of increased costs for fertilizers, increased costs of water, even just access to water. There are also the weather situation in terms of the change of weather, crop theft, but we have not heard a real aggressive plan for the government in this financial year to address crop production and food security. There lies in the estimates of expenditure, and under the Ministry of Agriculture, Mr. President, it says to us that in 2025, under measures to stimulate increased crop production, the government planned to spend $34 million. But it actually spent $8.3 million. So again, this is one of the areas where it is very important to Barbados, but the government seems to have saving money when they should actually be spending more in agriculture. So when we see now in 2026 that we are going to approve here today $26.4 million, when we come in here next March, April, you could see that they probably spent $5 million. So again, it doesn't give us any comfort that anything is happening in agriculture, that there's no thrust to really move the agricultural sector forward. And that has to be a cause of concern, not only for those in the industry, but for Barbados in general. And again, a lot of them are small farmers, small business people. And how are we going to support them when we want to direct quarter of $1 billion, to invite persons to come here to invest in businesses? So we can't take $275 million to tell persons to come into this country to do business. And we have small businesses in farming struggling for support. We have small businesses going and taking out loans at the Trust Loan Fund, but sometimes 6 months down the road, they can't repay them. You can't have businesses closing doors all around us, small, micro to medium-sized businesses closing doors because there's no support given to keep the doors open. But the government is focused on external before it focuses on internal. So food security is important. Focus on agriculture is important. The point is that you can put something in the document to be approved, but it is what you do after. And in agriculture, they have not put their money where their mouths are. They said they were going to spend $26 million last year. They spent, $34 million last year. They spent $8.3 million. Now they're saying they're going to spend $26 million. Please spend the $26 million so that we can improve our crop production in the country. Mr. President, as you can tell, I am interested in making sure that the resources put at the disposal of any government is managed carefully and it actually attends to the issues that we have to deal with every day. There are macro issues, there are micro issues, but there are things, Barbadians, when we go about our daily lives, we are feeling the reality. We feel the reality of the state of the roads. We feel the reality of the conditions of the schools. We feel the reality of the conditions at the QEH and at the polyclinics. We feel the reality where we have to go and buy produce that is imported, and we see the cost. But in this process, where a government is spending, Mr. President, billions of dollars on behalf of taxpayers, we have to make sure that those funds are managed in the best interest of Barbados. $5.6 billion is set to be approved during this debate, Mr. President. We need to ensure, as I highlighted, that we do not mismanage, waste, or squander money. I have explained to the Chamber, Mr. President, that if I total some of those things that we think have been mismanaged, that we get close to $600 million. What can $600 million do for Barbados today? I have also indicated, Mr. President, that as much as the government can articulate that we are going in the right direction, and in some cases we are, there are still some things that are of deep concern to Barbadians. The level of debt, the payments that we have to make on the interest, the ability to repay the principal payments because we are borrowing money to repay loans. There are a lot of things that Barbadians are concerned with, and I think the government has the opportunity to bring Barbados into this trust and this confidence by being more transparent, by fixing the audit office, putting the resources behind that department that they can get on with the review of the financial management of all government departments and special audits, and bring some accountability and transparency to the operations of government. Mr. President, with those few words, I'm obliged.
Thank you. Thank you, Senator Walters. Senator Cummings.
Mr. President, I beg to move that this sitting of the Senate be suspended for lunch until 3:30 p.m.
The question is that the Honourable Senate, the Senate be suspended until 3:30 p.m. today. Will those Honourable Senators in favour please say aye? Those against please say no. It thinks the ayes have it. The Senate is suspended until 3:30 p.m. today.